Very good. Right. We are changing the styles. We are increasing the intensity. I am coming with the new strategies because of the popular demand. So please be with me. When I say something, I mean it. Right? When I say something, I literally mean it. A yes is a yes and a no is a no. So the thing is, I'm giving a lot of practice, but people are not serious. People are not serious. I have appointed somebody to follow it up. And she is trying, but people are not even submitting the reports, letters, timetables, and anything. So what I'm doing is, that's it. I'm not going to force anybody. Because there is no meaning in every time, we cannot awake a sleeping person. It's, interestedly, wantedly sleeping, we cannot help. Somebody who's interested, we can do. So, show me that you're interested and I am with you. There are some people who say, sir, you are not calling us. Why should I call you? You are my student. I'm there on the platform. When you come into the classroom, I'm there. Every WhatsApp group, I'm there. I'm there everywhere. So I am not going to call you. Personally, why should I call you? How do I know that you're free or whatever it is? So please don't expect that thing from me. I'm not that kind of person. So what you're supposed to do is just post your timetable. If you're serious, let me know that you're. And those who do not post the timetable, I am not going to call them. At least posting a timetable, then I know that you're active. If you're active, show me the timetable. Then we'll be following you. Okay? Yeah. So we are going to learn a number of things. So don't miss anything. Maranang Makoko. Yes, Maranang Makoko. Yes, I saw your name. So what you have to do is, every one of you, write your name. Every one of you write your name, because I'm going to get seriously involved. I am dead serious. Dead serious. My word, a yes is a yes and a no is a no. I don't mind anybody. Next, that's it. Write your first name and second name. Meera Manoj. Good evening, sir. Good evening, Meera. Nofa Hamed. Very good. Today you have registered. That time you joined, you shot. It was just 12 days or 15 days you joined, but yes, you are coming back to me because you know my quality, and that's really very nice. You rejoined. That's very fine. This time I want you to get an. You got 350 in writing because you focused in writing. You got 350 because you focused in speaking. That's awesome. That's awesome. Awesome is not the word, because I really did not expect. But still, you cracked because you really did those two things. But at the same time, missed in reading and listening, because my lectures are long. Many people think that it's a waste of time, but because of that, you are here. No problem. You are my child. You are my child. It's the same love, one and all, undivided attention. There is no differentiation, no disparity, no any sort of differentiation. Everyone is, whether you're a doctor, or whether you're a nurse or anything, it doesn't matter to me anymore. You're my student, and that's all. All of you, those who are attending, please, please, please. And because Ashwini off duty now, still she's helping me. I cannot tax her much. I cannot tax her much. So leave it. Yes, I cannot tax her much. So what I'm going to do is, Dr. Maimuna, Dr. Nofa, and whoever doctor is there. Yes. Don't think that this is nursing letter. This is doctor's letters and nursing letter, both. I'm not teaching medical letter. I'm not teaching nursing letter. I'm teaching sentence correct constructions, whether you're a doctor or you're a nurse or you're a physiotherapist or you're somebody else. There is no difference. Sentence is a sentence. Construction is the demand or need. That's it. Okay? And remember, if you are students, you are students and nothing else. That's it. You are for me like how your patients are for you. You are a medical doctor and I am a language doctor. That's it. I am going to treat you just like as you are my patients. If you're a doctor, not for me. Indeed, I am your doctor. So learn properly. That's it. So don't think I am giving my time. Means it's a privilege I am giving to you. There are many teachers online. They take 10,000, 12,000 and just to teach 1 hour. Not even 1 hour. They will just give you notes, question papers. They'll call you in 5 minutes. They'll give you some blah, 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 finished. And they say good evening, get lost. I am not that sort of. This is a privilege because you are my children. Remember that. You trust and came me. So learn the most. If you feel that these are too much, stay back. Don't join, no problem. You will get your due amount of 15 minutes correction. And I'll correct the letter and I have changed. Okay? Because there is no meaning. So, learn today's sentences. Use in every letter with some modifications. With some modifications. And when I say use some things, use those things. Okay? When I say use, means use. When I say avoid, means avoid. Okay? Avoid means avoid. A soldier is always a soldier. There is no sleeping time. Are you a soldier in the war of OET? Don't say I have no time. If you say I have no time, then I have no time for you. Remember that. You are not for me. I am for you. You are not for me. I am for you. That's it. When the commander says, get up, just whether you brushed or you washed your teeth or took bath or sleep is lost or whatever it is, and get ready for war. Then only Otherwise, the enemy will attack and they will kill you. You are a soldier. You are my soldier, and I am your commander. No questions asked, no answers provided. That's it. Learn the best and bring me name. Okay? Bring me name. That's it. Fine. Yes. Right. Number one, how are we going to segregate the information into, or compartmentalize the information into distinct paragraphs, distinct, specific, particular paragraph, where this piece of information will go, where the pillow goes, where the knife goes, where the remote control goes. The pillow will go into the bedroom, the knife will go into the kitchen, and the remote control will go into the living room. Perfection accomplished. Suggestions are mine. Decisions are yours. No one is responsible for anybody else's actions. You do good, you enjoy. You do bad, you face the circumstances. I tell you, write like this, you pass. I tell you, don't write like this, you fail. I'll give all the options. I will not give the decision. You have to take the decision, because if you have a stomach pain, you have to take the medicine, not I. Here we go. Here we go. Get ready. If anybody wants to go in between, just go. Don't even say, I have duty. That is your problem. Don't say, I have something else. That is your problem. You solve your problems. I have n number of problems for myself. I am not begging you to solve my problems. You solve your problems. I solve mine. But your problem is mine. But your personal problem is yours. But in case you miss any session, go to the YouTube today and get it. Fine. Here we go. What are the most important things that we are going to do? This is called organization of the letter. What we are going to see now is number one, organization. How are we organizing a particular place, a particular house? This OET letter is a house. OET letter is a house. You know, I will not send any message to anybody. I'll just put it in the group. If you do not get, that means it is your duty to ask me. Okay? Fine. Yes. Number one is organization of the letter. Now, what is this organization of an OET letter? What is the organization of an OET letter? Now, let us consider this one. Segregating the parts and transferring them into the relevant paragraphs is called organization. What should be written first? What should be written last? And what should be written in between is called organization. When you meet somebody, You won't say, goodbye, we'll meet you tomorrow. And then say, we had a wonderful party. Then last, nice to see you. There is no sense in this. Disorganized, imperfection presented. So what is organization? For example, you should know the difference between ordinary letter and an urgent letter. I'm going to tell you different things. Now, what is the difference in these letters? So there is an official letter. I'll give you different points. Point number one, regarding organization. Organization. Now, suppose it is an ordinary letter. That means things are not serious. It's absolutely okay. It's absolutely okay. So to be common, normal, usual, general. So ordinary letter will not have that serious impact. But when you say urgent letter, it has a very important thing because the urgency is highlighted. Urgency is given priority. Priority of matters urgent over ordinary is organization. Priority of emergency action is more important than the other normal unimportant actions or things or aspects or concerns. Minor ulcer on the left toe, and the second one is unstable diabetes mellitus. Unstable diabetes mellitus. Unstable diabetes mellitus. We don't know the condition, how it is going on. It's an emergency. Unstable diabetes mellitus. Diabetes mellitus, I have been managing long, but suppose it is uncontrolled, it's emergency. So then what happens? Diabetes is not important here. Small infected left foot ulcer is not important here. But unstable diabetes mellitus is more important. People say, he presented with a small left foot ulcer, secondary to diabetes mellitus, unstable diabetes mellitus. To which you are giving importance. You are saying secondary to this, that means the primary you are giving. But why are you bringing this one forward, which is least important? Push it into the body. And what is more important, put it in the introduction. This should be secondary importance. But even before the primary one, why are you talking about it? Yes, it is secondary to unstable diabetes mellitus because diabetes mellitus is primary, that we are. But why are you taking the name of small infected left foot ulcer? Why are you bringing it even before unstable diabetes mellitus? Don't you know which is important? You know, no, that's why you are saying secondary to this one. Mind you, what is the most important? That one, bring it forward. And that only you write in the introduction. Don't write all the things in the introduction. Most important purpose for admission to the hospital is unstable diabetes mellitus. For small infected left foot ulcer, will anybody be getting admitted into the hospital? It will be just treated in 5 minutes and dressed and washed and cleaned and everything. Go home. Small infected left foot ulcer. Will anybody get admitted into the hospital? And that one you are making it into the subject of the sentence. Introduction of the letter. There is no meaning. Every point which I am telling is important. Every point which I am telling is important. Whenever you people are coming, just what you have to do is, if you have not written, whenever you are coming, first write your 2 names into the chat box, so that I'll take the attendance to know how serious you are. Okay? That's important. So, which is high priority? Unstable diabetes mellitus is high priority, and small infected left foot ulcer is very low priority. So this one should go into the introduction, and this one should go into the body of the letter. After dealing everything, then only you will talk about this. First paragraph, you will talk only about unstable diabetes mellitus. I mean the body paragraph, not the introduction. Because unstable diabetes mellitus is the urgent attention. It requires, demands urgent attention. So, now you see, a child is playing, another child is bleeding. That fellow is laughing and this fellow is crying. Whom do you attend first? Whom do you attend first? That is very important. Be very careful. Be judgmental. Judge what is more important. A person who is bleeding, leaving him and seeing the person, looking after the person who is laughing and playing is foolishness, ignorance, lack of common sense. Common sense. I'm not telling anything. That is a fact, whether you accept or not. That is a fact. If you are in the position of a mother, that is what you will do. So it is in your hands. Play safe. Think before you ink. Look before you leave. When I say something, write down. I said, think before you ink. Look before you leave. These are quotations. These are phrases. They may come somewhere in some of the OET question papers. Definitely. Right. Now here, urgency. Number one, you should know whether it is an urgent letter, VS, ordinary. Urgent, VS, ordinary. I don't know. I don't prepare anything normally. What comes into my mind, I'll just explain. So the first one is urgent versus ordinary. Now, what is this urgent and what is this ordinary? First and foremost, you should check. First and foremost, you should check whether this is an urgent letter or an ordinary letter. This is first point you have to see. If it is an urgent letter, write today's visit first. Make your own notes. I cannot give all the notes. Make your own notes. So, think like this. When you take a letter, think like this. First point. First point is this urgent letter or ordinary letter? If it is urgent letter, today's visit first. Today's visit first. That's one rule. And don't miss this session. This will come only after another 35 or 40 days. What I'm giving you this one. So, in urgent letter, write today's visit. In the first paragraph, immediately after the introduction. There are only 3 paragraphs. Plus introduction and the conclusion. An ideal letter will be only 5 paragraphs. An ideal letter will be only 5 paragraphs. If you are writing more or less, that means it is not up to the mark. An introduction and a conclusion, and in between 3 body paragraphs. Main body paragraph. Altogether 5 paragraphs, but we don't consider the head and the tail as the body. Head is head, tail is tail. They are not part of the body. Head tells about the body, and tail concludes the body. Head tells what you are going to discuss in the body. Tail tells what is the important thing in the body, and stresses those important things in the conclusion. That's all. And the conclusion is the reiteration of the introduction. That means stressing in a different way. Reiteration, not repetition. Not repetition, reiteration. That means telling in the same thing in a different angle. And if it is ordinary letter, don't write today's visit in this first main body paragraph. That is all. Then what to write, I will tell afterwards, step by step. And now this slide is only about one thing. If it is an urgent letter, today's visit in the first main body paragraph. If it is an ordinary letter, today's visit will not go into the first body paragraph. That's all. I'm not talking about the second and the third and that. This is only relevant for urgent letter or ordinary letter. There ends the matter. That is a watertight compartment. That's all. And what others you will know later states. I'm a good shepherd. Be my obedient lamb. If you go here and there, I cannot protect you. Be within my eyesight. Wolves are there aside. You will get distracted. You will get disgusted. You will get misled. And you will get confused. And at the end of the day, chaos. Write down. At the end of the day means finally. It's an idiom. At the end of the day means ultimately, finally, lastly. It's a very special way of telling. At the end of the day, Simon Sir taught, or Simon Sir acted, or Simon Sir is giving a lecture, or Simon Sir is preaching a lecture, whatever it is, whatever label you want to give, it doesn't matter. At the end of the day, Simon Sir's students pass the exam or not is important. How much ever you struggle 24 hours. I work hard. There was one mad fellow. She was telling, I did 3 reading tests every day, sir, but I failed. Where is the mistake? Where is the mistake? That's it. Doing 3 reading tests every day is not important. At the end of the day, how many questions you understood or how many marks you are getting counts as the priority. How much we have done is not important. How much we have pushed into the brain is important. So input over output. What you are doing is not important. How you are doing is important. I told you a number of times. If you want to go to Canada, don't take the flight to Australia. It is double pain. You waste your time going and you have to come back and again you have to go. It is instead of one round, you are taking 1, 2, and 3. Going forward, backward, and again going straight. So try to understand the way where you are going is leading you to threefold. 3 hours journey this side, you are going 3 hours journey this side and coming back 3 hours and again going 3 hours here. That means ultimately 3 hours journey became 9 hours. And all the more important is the tension you get into your mind. Prevention is better than cure. Waste your time and fail, or utilize your time properly and pass. That's what I'm saying. So urgent letter, ordinary letter. Is it understood? If you understood, say yes, because I'm teaching point after point. Point after point. I have taught a concept. Urgent letter means just hit the button, 10 seconds only I'm giving you. Until I see at least 15 yeses or nos, I cannot move forward. That's it. So, if it is urgent letter, in the first main body paragraph, you will write a today's visit. If it is not an urgent letter, you will not write today's visit. That's all. It's a watertight compartment. Urgent letter or not. Urgent letter, today's visit, first paragraph after the introduction. Ordinary letter, today's visit is not important. That's it. Just I'm waiting for your yeses. I can see there on the screen. Only 8 people have message there so far. How do I know that you understood or not? Now it's showing a red light for me whether to go forward or not. I need at least 15 yeses or no's. 11, it is yellow now. I'm ready to move, but I need another 4 to move forward. Because 3 out of 4 should understand. Then we'll go for the next concept. So 11 people. Yes. So Shehla, Ushas, Maimuna, Nofa, Marina, Meera, Rubina, Sangeeta, Bless Juice. I have just joined now. That's okay. You can watch afterwards. YouTube. CGG said yes. Fine. Now we are moving forward to the next point. The second one is a discharge letter. First one is urgent vs ordinary. The second one is a discharge or not. So you have discharge plan. organization. Point number 2. Discharge plan. Discharge plan. Okay. Discharge letter. Discharge letter, okay, is what? And discharge letter is what? In the discharge letter, the third main body paragraph will be instructions to follow up a post-discharge. Instructions. In the discharge letter, you will have instructions telling them what you have to do and what they should not do. Now let me clarify here. So now discharging means handing over the responsibility. But before handing over the responsibility, you will tell what was his past, what is his present, and what is his future. So discharge plan is future. I will not write any points, okay? You write whatever you want. In the discharge letter, I'm talking about the last paragraph. I'm not talking about the first paragraph. I'm talking not about the second paragraph. They will be discussed in something else. Only in the discharge letter, you will tell follow-up action, discharge plan. Okay. So in the discharge letter, what you are going to do is, post-discharge, the person who is responsible, what he has to do. These are called as standing instructions. These are called as standing instructions. Now, what are standing instructions? Standing instructions means do's and don'ts. Very special. Standing instructions will be given by a boss to a subordinate. That means do not miss, because they are of top priority. In urgent letter, the first paragraph is of top priority, but in the discharge letter, the last paragraph is of utmost importance. Mind you, this is a total contrast. In an urgent letter, the first paragraph after the introduction is of utmost priority, whereas in the discharge letter, the paragraph prior to the conclusion is of utmost priority. So introduction and conclusion, in between 3 paragraphs. Simon's left-hand rule. Introduction. And one more thing, I want to tell you one thing. There are some students, very serious students. Because of the non-serious students, the other students are getting affected. Okay? Don't disturb the others. If you have any problem, come directly to me. I am only the one who can solve you. Don't go to somebody and else. It's a very bad habit. If I am an unjust person, that's okay. I am helping you. So you have to come to me. If you have a problem with your father, you go talk to your father. If you have a problem with your mother, you go to your mother. If you have a problem with me, you come to me. The only thing is, nothing is more powerful than a request. Okay? Just say, sir, and there. Don't think that because you have paid the fee, sir will knock your door every time. I am a teacher. If I am a teacher, where is my respect? If I am a master, where is my reverence? I am your teacher, remember that. Don't degrade me to a level of your friend or an ordinary person. Please. That's it. Let my respect always be. If I am giving you privilege and I am giving you, I'm trying to do be friendly with me, with you, doesn't mean that you take over me and talk behind my back. I'm there to help you. Only I will help you. You trusted and came to me. I'm there to help you. So please allow me to help you. Now here, the last paragraph is the discharge plan paragraph. These are called as standing instructions. Standing instructions. Standing instructions are very powerful in business jargon. Standing. You can use these words if you become a boss or a supervisor. Standing instructions. So, standing instructions means they are not do's or don'ts. They are must do's and must don'ts. Ought to do and ought not to do. There is no excuse for that. For example, there are do's and don'ts in your OET letter. If you don't do, you will not be punished. If they say do this and you don't do, you will not punish. If they say don't do this and still you do that, you will not punish. But standing instructions, you will definitely be fired. That means no questions asked, no answers provided. Do it or get lost. So discharge plan or standing instructions. Standing instructions is a service offered to customers of a bank wherein regular transactions that the customer wants to make or processed as a matter of course instead of initiating special transactions each time. For example, I am going to take an office. I am going to take an office. I have an account in the bank and I write a standing instruction and I give it to the manager of the bank. This amount of 75,000 should be passed on to this account at any cost on the 1st of every month. And if they do not transfer, I can sue them to the court. That's it. Every time I need not call them and tell them, release 75,000. Every month I need. Standing instruction is once for all. And it must be done on priority basis without any excuse. De la mandate official. There is no excuse. That's it. Right. It's a business jargon, it's a financial jargon, it's a banking jargon. Okay, it's very important because people will lose millions if they do not pay. For example, if I do not pay them their time, then they can cancel my agreement. That's point to be noted. And if I lose that building, the same building I cannot get. And it's a very big damage for me. It's prestige for me. My yes is a yes, my no is a no. That is what people should believe in me. So that is called standing instruction. So something is told to you as a nurse, you must do this. More regular monitoring of medication compliance is recommended. That means do it. That's it. It's an order. And there is no excuse. You must. An appointment for review of medication has been scheduled. An appointment for review of medication, ongoing medication. Write down the sentence, somebody. I will not remember because quality is coming. Because I close my eyes, quality is coming. I go into a flow. I don't know who is there. I don't matter. I don't bother who is listening. One person is listening also, it's okay for me. I will be doing, redoing, refining, repairing, and adjusting, implementing, suggesting, and correcting, rectifying, and modifying, and making it perfect and perfecting quality. So, write down the sentence. Whenever there is a review appointment, you can use this sentence. If anything is missing, that clause, that phrase you remove. For example, in the outpatient department is not there, so remove that one. Date is not given, remove that one. Whatever is not given, remove that one. I'm giving perfection accomplished. An appointment for review and appoint at least one person, write it and afterwards send it. I'll be very happy. One person writes it and take a picture of that one, send it to me. Otherwise, it will be lost forever. That one person is important, so that everyone will get that one. If that 1% doesn't work, now everything will go. The world is running on this 1% of people, not 90 people who are normal, 9 people who are negative, only 1% who is positive. 90 people are neutral. Why they are living, they only don't know. They are nothing special. 9 people are negative, destroyers of everything. Why this headache? Why to attend this class? Why to write all this nonsense? We'll write something. No. 9 people, they will not do, they will not allow others to do. And they will spoil the show. Spoilers, we call them, spoilers. These are neutrals. 90 people are neutrals. There's no harm with them. But with these 90 people, there is harm. But this one person who is positive, because of that, that company will run. Because of that one person, everything will go on properly. So that one person, you should be there. Are you that one person? Positive. I don't want neutral people. I don't want negative people. I want only that 1% positive. That's it. So what I'm telling you, an appointment for review of the ongoing medications in the hospital outpatient department at 11 a.m. on 13th April 2023 has been scheduled. Everything is there. Information is given, add information is given, not given, subtract. Perfect sentence. No I, no we, no you, no he, no she, no, it, no personal pronouns. You get a 10 marks for every paragraph. Huh? For every paragraph. 5 paragraphs, you get 50 marks like this. Second one, no active voice. No repetition of words. 3 things you need in a paragraph. 3 things you need into a paragraph. Okay. I gave 5, but 3 are very important. Other 2 are not that much important. They are not mark scoring. First one is, these are called 3 avoidance theory. Avoid 3 things. First one is avoid personal pronouns because it is the cheapest quality. You will never pass. Never pass. Because in that there will be mistakes. If you write personal pronouns, you will definitely pass. But still there will be mistakes. Then what you will do? You will go down. Okay. You will go down. Then number 2. Active voice. Avoid. So first avoid is avoid personal pronouns. What is it? I, we, you, he, she, it, they. Avoid. Very low quality. That means your knowledge is not up to the mark. Okay. Your quality is not up to the mark. Number 2, active voice. Avoid active voice. Because the demand from the OET is passive voice. Of course, when you cannot write passive voice, at least write active voice. No problem. If they cannot give A grade, at least they will give B grade. That's it. That's the meaning. Active voice plus mistakes. C plus. Active voice without mistakes. B. Passive voice with mistakes. B. Passive voice without mistakes. B plus. Passive voice with the complex, compound, and simple sentences. A grade. There we call it a listing. I'll teach you all those things. I already taught. Now again I'll teach. Okay, that is also part of organization. That's also a part of organization. So, standing instructions means must do's. In the discharge letter, I'm talking only one paragraph at a time, okay? Because you will not, you'll mess up everything. With the urgent letter, only today's visit is important. If it is not urgent letter, today's visit will not come in the first paragraph. That's clear. Then next one. If it is a discharge letter, there will be something called a discharge plan in the last part. This discharge plan will be main body paragraph 3. Because main body paragraphs are only 3. These are 3 main body paragraphs. 1, 2, 3. Urgent letter, this is today's visit. Discharge letter, this is post-discharge or discharge plan. Standing instructions. That's it. So in this paragraph, in discharge letter, in the main body paragraph 3, what are you supposed to write is only that paragraph which is there in the discharge plan. Nothing else. Neither a word more nor a word less. Every point is important. You cannot ignore even one point. I'm telling you what is relevant information. In discharge plan, everything is relevant. Many people ask me, what is relevant information? What is relevant information? Every time you tell a letter, I should teach you what is relevant information, my head will blast. Because in this common platform, I'll give you what is relevant information. In the discharge plan, the last paragraph consists of relevant information, everything that is there in the discharge plan, everything, 100%, 1%, one word also don't eliminate. Even one word don't eliminate, because everything is important. That's it. Because you're telling somebody what to do. That's it. If you don't write, they will not do those things and the patient is going to suffer. Mind you, you're a doctor and you're a nurse, and if something information is not passed out to somebody properly and that person doesn't do properly, and who is suffering? The patient is suffering. How dare, because of you, the patient should suffer. Every word in the discharge plan is of high priority in the discharge letter. Now, don't ask me about second paragraph. That I will tell afterwards. Which paragraph is important and which, what everything will be cutting down. Okay. The most important things. This is patient-centered teaching. Urgent is first important, so we are urgent. Afterwards, after discharge, what should we do? Next is more important. So that is very important. Because the other person doesn't know what he has to do. He's a known patient, but he does not know what he has to do. What he did, he knows. What the patient's earlier condition, he knows. But what you are asking him to do, he will never know unless and until you specifically figure it out and present it in the letter and pass on the information. If that person is not doing, who is to blame? You. Whose responsibility? Yours. See that things are happening there. Your response. You cannot wash your hands. I wrote a letter, but you missed something important. Regular monitoring of medication compliance. Why did you not monitor? He is not compliant with medication. Why did you not monitor? Who is suffering patient? Will you let him suffer? He is reluctant. He is adamant. He is absent-minded. Like me, sometimes I forget. Sometimes I forget. So, absent-minded. I had my tablets. I forget. Nobody is there to remind me here. If somebody is there to remind me, I could have taken the medication. The course was not properly taken. So there is a recurrence, relapse of the same problem. 15 days back, I went to the Trivandrum Medical Hospital. Just was painful. I got the medication. What I'm telling is not irrelevant. I'm not cooking stories here. I'm giving you a live example. Nobody to help me. I kept it there. I forgot. And just 4 days back, it affected this side. Then one friend of mine said, take that medication you took last time. I forgot that that medication was not there. And I took it for one day. Then it said, then again I forgot, because again nobody remembered. When I told my friend, this time it is paining this side. He told me, take that medication. You said last time you took medication. I think this is the same. Which location here? Which location here? So take the medication again. I took it. The next day I forgot. Okay. And today I got tension and it shifted to this side. I relaxed it. And when I shout, and it pricks me. It's not 100% because of course I did not take it, maybe because of whatever it is. But when somebody tells, you should listen. But where is anybody to tell? I'm telling you, I'm giving a nurse to respond, take the responsibility of this patient, and that nurse did not remind me. Then what I'm doing? I'm not taking medication and I am suffering. So is it not your responsibility as a nurse to remind the patient and check whether he's taking medication regularly or not? Confirm. Go to him, call him. Did you take the medication today? Oh, nurse, let me check. Check and tell me, did you take or not? Did you forget? Nurse, I forgot. Thank you for reminding me. After 5 days course, I will not have any problem. After 1 month course, I will not have. At the review appointment, on the date of the meeting with the doctor for review of medication, everything is perfect. So withdraw the medications from tomorrow onwards. Otherwise, the problem is still not completely healed. So take the medication again, full course. So don't stop in between. Who is suffering? What are you for? What is your responsibility? Are you shouldering the responsibility? 100%. All these are not important. See here, this is the grip. This is the grip. I have given you 4 points. Simon's left hand rule. Are you doing your job? Your responsibility? Taking concern every time? Are you shouldering the responsibility? Is the patient fine? This is very important. Whether you do all these things or not, nothing important. It matters nothing. At the end of the day, the patient is fine or not. Nobody will ask anything else. How is the patient? It is the symptom. It is the sign for the perfect management by you. Even if you did not manage properly, if the patient is fine, the credit goes to you. Remember, at the end of the day, patient's priority is of utmost prominence. Patient's priority is of utmost prominence, mind you. So that is called standing instructions. Not even everything important things only you will write there. No. Doctor is making notes and he is giving to your nurse and write a letter and send it to the community nurse or home care nurse. And what you are doing? Doctor has given all the notes, what all should be done, and you missed one point. Doctor did his duty. He gave all the notes to you, and you did not write one point from the discharge plan. Whose mistake is it? Discharge plan is perfect. Every point you have to transfer on to the letter. Every point, 100% relevant information. Discharge plan is 100% relevant information. Don't dare to play the fool with fire. That is fire. In the urgent letter, today's condition is fire. Only today's condition is fire. That is, everything you noticed today is relevant. So that is first paragraph relevant information. This is last paragraph relevant. That is for urgent letter. This is for discharge letter. Having a I have given all my dues. I told everything clear. Did you get me? Are we together? Means, are you sailing in the same boat? I explained everything. Did you understand everything? That is the meaning. If it is a yes, hit the button yes. If it is a no, hit the button no. Just giving 10 seconds. Many people believe in one system. I believe in another system. Many people believe in one system. I believe in one system because I am a teacher. I'm not just a teacher. A teacher will only give subject. But I'm a teacher trainer. I'll give you relevant information and I'll give you styles how you have to. I will not confuse you in many different things. 1 point at a time. When you are cutting down a tree, one blow at a time. You cannot give. You cannot give 10 blows at one instant. You cannot give 10 blows all at once. Laraib, can you please switch off your video? I don't know, absent-mindedly, you might have switched on the video. Please, and thank you. I'm waiting for you to stop your video. Because if we put videos, any other video than the other person speaking, it will distract. Please. And when you are on this platform, mind that. Because I don't even look what is going on there. Because I'm focused somewhere. Okay. Please, all of you. Not one person, everyone. Maybe that poor girl, absent-mindedly, she might have switched on because nobody wants to do that. Absent-mindedly. So, be careful. And be guardian angels. Because this is my platform. Okay, somebody is sleeping, or somebody is cooking, or somebody is in the office. Okay. And what they are doing there, we don't want to see here. Okay. Because I cannot monitor all these things and I don't have anybody to help me small things also. All these things I cannot. So please help me and see that nobody's video is on. If anybody's video is on, just other students, just message them, please close your video in the group because help them. No problem in that. It's not a mistake. Wantedly, nobody does. But please tell them because they don't know maybe. So they will notice. They are also involved in the lecture. They are also involved in the lecture. So please. Okay, please. Right. And all of you, be my eyes. Watch if somebody is doing something. Okay, you can directly call on my phone. If anybody is there, I will definitely pick you up here. Mentor. I would like to finish up all grammar, passive grammar today, please. Oh my God. Yeah. So, now I asked you one question. So, 1, 2, Neha. Okay, Bless Jose, 1, Shahla, number 2, Neha, number 3, Laraib, number 4, Tricia, number 5, Wishes, number 6, Rubina, number 7, Stella, number 8, Maimuna, number 9, Abdullah, number 10. Abdullah Ahsani from the Middle East, I think. Very good. Welcome to the platform. Nasra Sandamali. Very good. Fine. Thank you for informing regarding the switched on video. Right. Right. So next point, we are moving forward. In the meantime, give me time because my mind is blown because I was a little distracted with some things. So I'll just prepare a cup of tea because I have already taken a whole lot of my energy. I need a cup of coffee with your permission. In the meantime, invite your friends. Invite your friends because they will get the lesson of their life. I did not imagine that I'm going to teach these things. I imagined something else and I started something else. That is what I do because it comes from inside. I don't plan. This is natural. You see, never I plan anything. Everything. I come to the table and I start. How my mind takes, it goes. Because I do with the passion. I do anything with a passion. Hello, Dr. Sarah. I'm in a live session. Can I call you back later? I agree with whatever I have seen that one. Okay.
Absolutely.
Thank you.
Absolutely.
Thank you very much, dear. Thank you very much. So, you can call me like this if any problem is there on the TV. Anybody's screen is video is on or anything, because most of the time I'll be closing my eyes. I don't know if anybody, okay, writes on the screen also. Sometimes we see many people write. I close it normally now. So please give me 3 minutes. 3 minutes. Okay. 3 minutes. 3 minutes. 3 minutes. Okay. Right. And if anybody has any problem, okay, I am your mother. I am your father. Come to me and share with me your problems. Because if you go to the neighbor's house, neighbor will not help you. Okay. Neighbors will not help you. Come to me because I only can solve your problem. You call 10 people or you meet 10 people, they cannot solve your problem. They cannot solve your problem. I am the only person can solve. And you know that very clearly. So come to me and talk to me. Will you go to the neighbor and talk about your mother? Remember, I am your mother. I'm not upset about some people doing these things. Those people already know what they did. But I'm telling you, I'm your mother. Don't go and complain about your mother to your neighbor. Okay? They're not going to help you. Okay? So no need. Come to me. I am there. I am your panic button. Just come to me. Whatever your problems are there, just come to me. And I'm going to help you. Right? And nobody can take my place. I know that. So give me 3 minutes. I'm preparing some coffee. I'll get some water. And in the meantime, Invite your friends. Something is better. I told you, learn from the crows. What is sharing love? Okay. When some food is seen, even if it is little food also, they will call 10 crows. All the crows will come. That is called crow mentality. Crow mentality. Let us, in learning, let us have crow mentality. Okay. And from tomorrow onwards, I am done with everything. I'm all yours. I'm all yours. Morning 9 o'clock till night 12 o'clock. I'm all yours. I don't have anything else on my mind. I'm all yours. Right. So I'll be there. You can have your grievances. You can discuss with me. And I don't know what time I will take class, when I will take class. I don't know myself. I'll just come and give you the link. Okay. I'll just come and give the link. Today also, 2 doctors I gave admission. 2 doctors I gave admission. I asked them, are you working? And if they say I am working, I will not give them admission. Okay, for nurses, I'll excuse because they are helpless. But for doctors, I will not give excuse. Okay. Only those students who are fully paying me attention, then only I'm giving. That's verified. Ask them if you want. They are on this platform today. You know those doctors also. Right. I told them openly, point blank. If you're working, I'll not give you admission. That's absolutely fine. They pay me more money. Doctors pay me 20,000 per month. I take only 12,000 per month from nurses. And that also some people I give discount also. But even if they pay 20,000, I don't want, means don't want a yes is a yes and a no is a no. That's it. I'm not great. I have some standards. I don't change for others. So when somebody has love to share with you, knowledge, be attentive. Don't tell me, sir, you are teaching when I am in duty, sir. That is not my problem. Okay. I am there for correcting your letters. I'm there for speaking sessions. If you're not available, give me 20 minutes. In 20 minutes, I'll take 5 minutes speaking session and 3 minutes I will give you feedback, and at 12 minutes I'll give you writing correction. There ends the matter. But if you want to learn like this, give me your time and your ears. Give me your time and your ears. Money, that's nothing. Your time is more important than money. Last week, there was one fellow who gave some 20,000 to some leaked papers. Nothing. Ultimately, they cut the phone. It seems they are not talking only. Like that. I am not like that. You give 20,000 and they will not answer. But here I am there. Who wants your money? Money everybody is ready to pay. Right? I am special. I don't want to be ordinary. Let me be special. Don't play the fool with me. Right. This is the reason why, because of some people, no, I have totally stopped giving admissions, only restricted after a lot of scrutiny I'm giving. Okay. So you are privileged to get this knowledge because you are my children. Learn the best. Be the best. I'm not going to get any name with the people who are not attending and failing. It's not my mistake. I'm teaching there very clearly. Okay. I'm teaching from morning to evening, something or something I'm doing. So it is not mistake on my side. Okay. So please attend. So 2 points we have gone. Still there are 5 points. 5 points more. In the meantime, okay, what I want you to do is write 2 things. Number one, share. It's a request. It's not compulsory that you have to do. Okay. Share this link with 3 friends. They will thank you. They will thank you. They'll be proud of you, saying that you are the best friend. Okay. So share this link with the 3 friends, whichever I gave you now. Our Zoom link. Number 1. Number 2. I don't know what, because I don't know what quality I gave. I don't know. If a movie is hit, people watch it, people go to the movie and watch it, that means it is a hit. They can understand. If people don't go to the movie, that means it's a flop. Hit or flop. I don't know my lecture whether it is a hit or flop. You are the people who have to explain me that it is good, sir. We need like this, like that. If you don't say anything, how will I know that what I am teaching is good? So if you tell me only, I'll give you more like this one. If you say, sir, this is not nice, so don't teach us these things. These are not enough. We can read from the books and learn. Just to correct our letters. That also you write. Whatever you feel from your heart, write that. But only one thing. Constructive criticism. Don't talk all negatives. Constructive criticism. Mr. Simon's blood group is B positive. Okay. Don't write any negative comment there. Instead of saying your teaching is nonsense, you can say, please improve your quality. That means it is nonsense only. Quality is less, that's why improve. If you say, please improve your quality, that means it is low quality. I can understand. Okay. So instead of destructive criticism, give constructive criticism. Don't say you did not teach this, you did not do this, you did not do this, you did not do this. Negativity is not my cup of tea. Okay. Be positive is my blood group. Only positive points. Please. Yes. Write, share your valuable feedback. Okay, nobody wrote anything till now. Okay, fine. Yes. Hello. Yes. Number 3. Time factor. Time factor. Past, present, future. Past, present, and future. Before starting this, yeah, let me just talk with some of the candidates. Who is there? Yeah, unmute. Nobody opened the. Very good. Very good. Excellent. Nobody opened the mic. I did not. I forgot. That means people are becoming very standardized. Good, good. Okay. Now coming to the point. First, let me welcome the new students. Yeah. Yesterday, there one doctor joined. Today, one doctor joined. There is only one more place for doctor. If anybody is interested, okay, you can tell. Right. Now, coming to the point. Abdullah Al-Ahsani. Ahsan. Abdullah Ahsani. Hello, Mr. Abdullah.
Hello, doctor.
Yes. Can you introduce yourself as Mr. Abdullah Ahsani?
Yes, I am Abdullah Fani. I am 50 years old. I have worked in Iran as a dermatologist for 20 years and just now I am living in UK in London for 3 years.
Okay. What is your profession?
Dermatology.
Dermatologist. Okay. Skin specialist.
Yes.
Okay. So which profession you are writing? Medicine or something else?
Something else.
Which profession you are writing in the OET? There are 12 professions. Which professions you are writing? OET exam.
For the exam,
medicine or
medicine,
physiotherapist or like that? Or
medicine.
medicine. Yes,
Medicine.
yes.
I want it.
Okay, okay, fine, fine. That's fine. Okay. Are you from originally from which country are you?
I am from Iran, Kurdistan state of Iran.
Kurdistan, Iran. Okay. Is this the same name which went in the past called Persia?
Yes.
Right, right. Then I'm right. Okay, fine. That's fine. That's fine. Okay. That's very fine. How do you find our sessions?
That's great for me, but I am new and unfortunately I have not enough time. But your teaching is very well. Thank you.
Welcome. Welcome to our platform. You can attend the sessions. Okay, if you have anything, you can just contact me on the same WhatsApp contact which posted the video. Okay, fine. Thank you very much. And then next one is Ashley. Hello, Ashley. I'm just greeting the new students who came to visit us.
Okay, thank you, sir. I'm fine, sir.
Yes, Ashley, can you share a few words about yourself and you came for this first class with for you and yeah, share your experience.
It's a nice class, sir. Actually, I'm enjoying this class. Nobody won't teach like this in each and every point, sir. If you will join for, I also last year I wrote an OET, and in that I got teaching from one of the OET teacher also, but she won't teach like this, sir. You are a good teacher and teaching us like each and every point you are mentioning it. So I'm enjoying this class.
Yeah, can you introduce yourself, please? What is your name?
Okay, okay.
Where are you from? What is your
I'm Ashley and I'm from Kerala. I'm working also as a nurse.
okay, fine, fine. Very good. Thank you very much.
Okay, thank you, sir.
Yeah. Bipana. Bipana Shah. Unmute.
Hello, sir.
Hello, Bipana.
Hello, sir. How are you
Yeah.
now?
Oh, okay. I'm having a cup of coffee. Earlier, my tongue was dry and now it is wet. That's the difference. Thank you for asking. Yeah. Share your experience regarding this session.
Yeah, you know very well. I'm very fond of you. I always love to listen you. So
Oh,
whenever I get the time, I join
don't
you.
comment anything about me. Comment about the class. Okay. Yeah. What did you learn? Hello, Vipana. Yeah, tell me, what did you learn today and how was the session?
Yeah,
How
what
did
I'm saying is you teach very minor things. No one teaches those things for any classes. They go for the details, but these are the minor things which helps. That really helps.
but people say we don't have time to listen to all these things. Why we need all these things? So then you says, do you think that you need these things or you don't need these things?
No, these things are needed. It's very much these small things only helps us to make the big things, right?
Yeah. Okay, fine. Thank you very much. And then any,
And
yeah, thank you. Thank you. Stella Mazechunyu. Stella Mazechunyu. Stella Mazechunyu. Welcome to the platform, Stella. Huh? Disappeared. Should not have called her. At least she would have stayed there. Okay, fine. That's all others are there already. Nobody is new. So that's fine. So we are going to the next part. Okay, before moving, just write one or two sentences about what you learned and how the session was. Share your valuable feedback. Yes. Right. provide your feedback. Yes, we are moving again. Last 1 minute. If you want to write anything, you can write, because we are moving into the next point. In the meantime, the people who went also, they will come. I told them 3 minutes gap. Okay, 5 minutes, we'll wait. Another 1-2 minutes. So in the meantime, you can share your valuable feedback. Yes. Nice session, sir. More valuable made, points made. Nofa Hamid, thank you for your feedback. Yeah, attend sessions regularly. Don't think that the session is long. They are very valuable. I cannot explain. You just tuck, 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 tuck and give it like that one, because you are my children. Remember that. Next one. Next one is, the session was informative and it opened my mind to the contents of the few letters in OET, especially urgent and ordinary letters. Maranak, Makoko, your sentence quality is very good, but start with a capital letter. The session was informative and it opened my mind to the contents of the few letters in OET, especially urgent and ordinary letters. There is no mistake but except one, that is the T should be capital letter. Okay, next one. So really nice session, sir. Now I understand the difference between urgent and ordinary letter. Okay. Yeah, that's good. Bless Jose. Sir, session was really useful and I started making changes in my sentence construction. Keep going ahead. Thank you. Thank you very much. Nasra Muhammad. This session is the most important one. Nasra from Sharjah. Okay. I have too many names, so I'm getting confused. Okay. The session is the most important one that I was waiting, because when I'm writing, I get confused with which part of the notes should I start with. Wow, Nasra, not even one mistake. Not even one mistake. How come? I cannot believe my eyes, Nasra. Nasra, I really cannot believe my eyes. You amazed me. This session is the most important. I'm trying to find a mistake again. I want to read it, check if any mistake is there. I missed anything. This session is the most important one that I was waiting for. That I was waiting for. Okay, mistake is there. Mistake is there. That is beyond your understanding. Okay, even I did not realize in the first go. When I searched for mistake, I got it. So that is how it is. This session is the most important one that was waiting for. This session, that is, I mean, waiting for. I was waiting for the session. That's for is important. Because when I am writing, comma, I get confused with which part of the notes should I start with. Awesome. Awesome. Your method is a step by step and you explain all of the details precisely. Awesome. Even hyphenation is very good. Abdullah Ahsani. Abdullah Ahsani. Your sentence has no flaw. Your method is step by step and you explain whole of the whole of the detail, the whole, one unique, the whole. Okay, the whole, the complete. Whenever you have 100%, whole means 100%. You have to say the. The next one. Sir, your way of teaching not only makes us understand, but also makes us confident. Starting with a capital letter, ending with a full stop. Otherwise, everything is fine. Not only makes us understand, but also makes us confident. Full stop. S capital letter. That's fine. Yeah. Yes, we are moving ahead. We are moving ahead. Yeah, there is one more new student, new member, Sajal. Hello, Sajal. Hello, Sajal. Yeah, you can answer if you want to talk. Otherwise, it's okay. Right. Okay. Now, the next point is organization is a time factor. Time factor. Time factor. I'm going again to the discharge letter only. I'm going about to the discharge letter. This is organization of time. Organization of time. Okay, organization of time. In organization of time, discharge letter is the least urgent letter. It's a very cool letter. Very cool letter. It's not a hot letter. Urgent letter is a very hot letter, extreme, 100% importance. But this is, there is seriousness. This is relaxed state. Because you are discharging. You're not even transferring, you're discharging. Means everything done. There is nothing more to do now. So it's very cool state. Cool state. Transfer, still problem is there. That's why you're transferring to another hospital or another emergency department or transferring to somewhere like that. But discharge letter is a very cool letter. That means no tension. Important things are there. Every letter is important only. That is why relevant information only you are writing. Okay. Now in a discharge letter, what you are going to write? Okay. The time factor. The letter is divided into 3 parts with a head and a tail. Head is the introduction and tail is the conclusion. So Simon's left hand rule. Head is the introduction, tail is the conclusion. Now this is the discharge letter. Past, present, future. That means this is hospital, in the hospital. This is upon admission. This is upon admission. This is during hospitalization. That means from admission till discharge. From admission till discharge. I think you can understand through my explanation here, demonstration. Upon admission, and from admission to discharge, during hospitalization, from hospital entry to exit, admission to discharge. So this is during hospitalization. The period first day to the last day. First day is admission day, last day is discharge day. From the time of admission till the discharge is called during hospitalization. That means present period. Present period. Past is upon admission, means upon admission how his condition was. Before, at the time of admission, how his condition was. That is coming from before. Then next one, after admission, what we have? Earlier, very serious problem. So he was admitted. So we did these actions, we did these activities to solve this problem from difficult state to normal state, from serious state to ordinary state, from extremely tough situation to extremely cool situation. So discharge letter, cooling down. So now we are passing on what they have to do after discharge. First one is before discharge, how it was. So that's why admission. After admission, what we did. So that's why discharge. If we don't do this, we cannot be discharged. So condition was worse, condition became the best. If condition is not good, you would still keep him in the hospital. Condition is good now, so you are discharging. So after discharge, you check all these things so that again problem will not come and again admit him. So after discharge, what you have to do? Before discharge, how his condition was. After admission, what we did. After discharge, what you have to do. Before discharge, how the patient's condition was. After admission, what we did. After a discharge, what you have to do, the person who is receiving the letter. I think information is very clear. Information is very clear. So discharge letter, because he is safe now. That's why discharging. On safe grounds, you are discharging. On difficult grounds, you got admission.
O da canettir, candır.
So, I hope you understand everything now. The condition was worse. The condition was worse. So that's why admission. So upon admission, the condition was worse. The condition was worse. That is introduction. So before admission, this was his condition. Okay. Worse condition that you have to write here. Okay. In the first main body paragraph. And how we manage that condition through these medications, this exercise, this treatment, this surgery, this dressing, and everything. Intravenous injections, blood glucose levels, weight, temperature, blood pressure, and all these things during the hospitalization. All these things will go into during hospitalization. Blood glucose levels during hospitalization. Tests during hospitalization. Okay. Because doctor only will prescribe all this. Medications during hospitalization. Everything what we did from admission till now is here. And only if it is important to the other person, you have to write this one. Otherwise, you need not write. Remember that. If it is important to the other person, then only you will write. Otherwise, you don't write. If you are writing to a physiotherapist, okay, you need not write about some information. Remember that. If you are writing to a dietitian, you need not write that information. Exercise regimen should go to the physiotherapist. Dietary regimen should go to the dietitian. That's different. Those are two different things. But to a nurse, all these things will go. Exercise regimen will go. Physiotherapy also will go. Dietary regimen also will go. Because nurse is all in all. Physiotherapist only bothers about exercises. He doesn't bother about diet. Dietitian only bothers about diet. He will not bother about exercises because it is not his area of specialization. So what you write to a physiotherapist, you need not write to the dietitian. What you write to the dietitian, you need not write to the physiotherapist. But what you write to a physiotherapist and what you write to a dietitian, both will go to a nurse. Because nurse will manage all these things. He will take him to the physiotherapist. He will take him to the dietitian. He will make an appointment there. She will make an appointment here. And she will follow their suggestion. So for a nurse, all this information is relevant. And in the same way, to a doctor, all this information is relevant. What you write to a physiotherapist is needed for a doctor. What you write to a dietitian, you will write to a doctor. Definitely you have to write because doctor needs all these things. Doctor needs what physiotherapy is taking. Doctor needs what diet he is taking because he's a doctor. Mind you. Okay. That's a different thing, relevant information. That's a different part. That is roles. This is time factor. By mistake, I already started here. Okay. So past means upon admission. You will start with the phrase upon admission or initially presented with or he was admitted with, that is first paragraph. So it is upon admission paragraph. Second paragraph is during hospitalization paragraph. Third one is upon discharge paragraph. Upon admission, during hospitalization, upon discharge. Now you understand it very clearly. Before admission, after admission and before discharge, that is during hospitalization, in between, and during, upon discharge. Means after discharge, what you have to do. Sorry. Is the information clear? Say yes or a no. If the information is clear, say yes. If the information is not clear, say no. Because we have to go to another point now. Relevance according to the professions. This is relevance according to the time. That is relevance according to the urgency. This is relevance according to the discharge. This is relevance according to the time. So all these things you have to consider. Yes, all of you hit the button fast, 10 seconds. Say yes or no. If you are not saying yes, how can I move forward? Bless Joes, 50-50. Yeah. So for Bless Joes, what you can do is, if another two people says 50-50, then I will explain again. If another two people don't say 50-50, then you have to visit YouTube and you can watch there. Or at least one person can say, I did not understand, sir. not 50-50, 0%, then I can explain. 125% or 250%. Yeah, what about others? Come on, fast, 10 seconds only. I don't need to beg you. Come on, feedback. Yes. So you don't want to give. Lara, yes, sir. Please repeat which you told just now about the paragraphs. Okay. So I am repeating. So bless Jose, you have a partner here. Right. In a discharge letter, so every paragraph has 5 paragraphs. Every letter has 5 paragraphs. In a discharge letter, first you will write introduction and last you will write conclusion. Now 3 paragraphs are remaining. First one will be past, second one will be present, third one will be future. Present means now in the hospital. Future means after discharging from the hospital. Past means before admission to the hospital. So previous condition, present condition, future action. Previous condition, present condition, previous condition, present treatment, future actions. So before admission, how was the patient's condition? What was the doctor's treatment? What is the follow-up action after discharge? Before action, what was the present patient's condition? That is first paragraph. Second paragraph, after admission, what did the doctors do till he got discharged? Then after discharge, what the follow-up nurse or somebody else should do? Okay, these are the 5 things as it is. Introduction, upon admission, during hospitalization, upon discharge, conclusion. Is that clear, Jose? Bless Jose. If it is clear, say yes. Lara, is that clear? So I told you about discharge letter, all the 3 paragraphs. Discharge letter is finished now. Organization. Okay. And the paragraph organization, this is letter organization. Paragraph organization is another one. Which one should come first? Which one should come next? For example, medication should come first, then exercise, then diet, then dressing and other things. Order. First medication. Second one is exercise. Third one is dietary. Fourth one is dressing changes. Okay. And the last one will be, not last one, before that one will be laboratory reports. And the next one will be body mass index or weight. So that is paragraph organization during hospitalization. That we'll see later. We're talking only about letter organization, how to divide into paragraphs. Then, so this is organization. And the same one, relevance also will be there. Okay. Next one. Fourth one. Fourth one is priority elements. Priority elements means relevant elements. What is priority elements and what are relevant elements? Okay, fine. That is objective presentation. What he requires, that only you will write. Not subjective. Subjective means how it should be. Okay. Objective means what he requires. Person, community nurse. Okay. Community health nurse. Or care home nurse. Or a physiotherapist. Or a dietitian. So, to whom you are right. So it depends on profession specific. Profession specific. Now, doctor needs every bit of information. Doctor will need every bit of information. But if you are sending to a surgery, you write only information regarding bones. What surgery? Okay. What type of surgery? For example, bone fracture. Surgery and putting a stent. Okay. A long thin object put inside a tube in the body, for example, a blood vessel, so that its walls stay firm or so that the body fluids can flow easily through it. A stent. Okay, for example. And rods. You put rods, medical. Okay. So medical dictionary, you can check rods. They put inside the body. For example, my father had an accident and his thigh. Okay, they put rods there. So that's it. So when the surgery is there, you will write only about previous related to that problem only you write to a surgeon. Okay. You will not write about something, a medication to him. You will not write about diet to him. You will not write about exercises to him. But when you are writing to a doctor, when you are writing to a doctor, all of them are important. Because doctor, general surgeon, general physician, he requires all these things because everything is related to him. But when the doctor refers to a surgeon, he will not talk about his diet, he will not talk about his exercise, he will not talk about his medication. He will only talk about what happened to him and his medical condition related to this. Okay, bone fracture and other things. So that is called relevant information according to their professions. If you are writing to a nurse, you have to write about medication. You have to write about diet. You have to write about exercises. You have to write about dressing changes. Everything. Why? Because she is all in all responsible. And to a doctor, all in all responsible. Yes, doctor and nurse. If the other person is a nurse, the receiving person is a nurse. If the receiving person is a doctor. Okay. So you must include all this information whether it is physiotherapist or dietitians, okay, or medication, everything is needed. So write all the information when you are writing to a nurse and a doctor. Okay, if it is applicable to them. Earlier he had this disease and that is solved. So why you are writing about that disease and that medication? Try to understand. Disease is permanently cured. Okay. Now, that is relevant according to profession specific relevance. That means you have to write the information suitable to him. If you are writing medication related thing to a physiotherapist, there is no meaning. If you are writing dietary regarding information, dietary related information to the physiotherapist, there is no meaning. Don't send a dietary information to a physiotherapist. Don't send a physiotherapy related exercises related information to the dietitian. Both are irrelevant. Then what is relevant? Food related information to the dietitian. Okay. And exercise related information to the physiotherapist. So that's it. His hand is not moving properly because his range of motion has some problem or something like that. What is the use of giving this range of motion exercises information? Our hand is not being able to be stretched freely and difficulty. The nerves are holding all these things. What will the dietitian do with this information? So sending physiotherapy related information to the dietitian is irrelevant. Sending the food related information to the physiotherapist is irrelevant. But both these information, bits of information, food related information and exercise relevant information, if you are sending to a doctor, if a doctor is sending to a nurse, or if a nurse is sending to a doctor is sending to a doctor, a nurse is sending to another nurse, these must be included. They are absolutely relevant information. Because nurse cannot say this is not my job. Doctor cannot say this is not my job. He is the only connect, he is the junction. Nurse is a junction and doctor is a junction. Okay. Remember that. But others, physiotherapist will not write to dietitian. Remember that. He will write to a general physician. Okay, medical practitioner. And medical practitioner will check if any problem is there, and he will. Medical practitioner is the person who is routing, sending patients to different places. If surgery is needed, he will send to surgeon. If dietary regimen is required, consultation to the dietary. Physiotherapist is required. Who is the connecting link? Doctor. I don't know what I am speaking also, but you know, understand very well what I am speaking. Okay. You may be thinking, sir is closing your eyes, and because I'm going into deep depth. So, a doctor is the source, a resource person. He cannot say no to anything. A nurse also cannot. These two are complementary, doctor and nurse. Without doctor, there is no nurse. Without nurse, there is no doctor. So nurse will send to a doctor, doctor. So that's it. Because doctor tells nurse, writes case notes and says nurse writes. Nurse is not there, doctor himself writes. So these two are the people who are discharging this patient or transferring patient, whatever it is. So be careful. Right. You go to a doctor, dental problems are there, so you'll send it to the dentist because you are not specialist. Okay. Skin problem is there, you'll send to a dermatologist. We'll send it to Dr. Asani. What's the name? First name I forgot. Okay. He's in the UK now. We'll send him there. The next one, if there is problem related to movement of shoulder or hip or elbow or knee or wrist or ankle. Now, what are these? You know well. Shoulder, elbow, wrist, hip, knee, ankle. Any joint is not moving freely. You'll not send to a surgeon, you'll send to a physiotherapist. If there is a fracture only, you'll send it to a surgeon for treating that. Bone specialist. Right? In every, there is a surgeon in every area. Cardiologist. Okay. Specialist. Craniologist, brain. Pulmonologist, lungs. Okay, there's a specialist for everything. Ophthalmologist, eyes. Dermatologist, skin. So all these are professions, specialists. So all these specialists have contact directly to with the general physician only. Without general physician, they cannot operate. So first, when the general physician, medical practitioner, diagnoses what exactly the problem is, then he will, so he is the junction. What I am telling you is very important here, because this lecture and our lecture, mostly they are from doctors and nurses. That's why I'm telling you. You have a different role than dentist doesn't have much problem with this. Because you are multi-dimensional problem. Nurse also same thing. Okay. Nurse also the same way. Profession specific. Priority elements. Once again, I retrieve the information. How are you going to organize your information? How are you going to select whether it is relevant or not? Then only it will go. If you are writing a letter to the physiotherapist, when you are organizing a letter, you are not putting information related to this one. That means you are avoiding this one. Okay, in this particular paragraph, okay, you will write which one related to that, what they need. What they need, that information will you write. For example, is a diet. Okay, only the diet will go to dietitian and exercise will go to physiotherapist. But when you are writing to a nurse, doctor is writing to a nurse, you write all these things. And when a nurse is writing to a doctor after home visit, she will also include all this information. Whether it is a physiotherapist or a dietitian or whatever it is, all will go to the doctor must. Especially what is there in the discharge plan while discharging. So this is priority elements. I am giving my own labels. There are no labels like this. I'm giving these labels so that you can understand. Because without any label, you don't understand what it is about. I can go on teaching like this without telling anything, but afterwards confusion will be there for you. So priority elements based on profession specific information. Right? So this is the fourth point. This is the fourth point. Right? Very good. Very good. Yeah, next one. So fourth point is given. So profession specific information is the fourth point. Profession specific information. The fourth. Social worker. Social worker. We are writing to a social worker. What is the information you can give for a social worker? Remember that. Which she can manage those only. Social worker. Okay. What is the type of work she can manage? That only you will give, no? Right? What is that? She will come and observe all these things. What responsibility you are giving her, those only you have to write. What you can give, you already know, no need to do that. So profession specific information. If the information is clear, this point is clear, say a yes. And if it is not clear, just type no. 10 seconds because I'm going. Ten seconds, please. I don't have all the time in the world, okay? So, to tell you frankly, I did not have lunch in the afternoon. So I'm a little bit hungry, so I'll have an early dinner. So just fast. Yeah. Who is this who said no? Simon. Right. Azubike. Welcome back, Azubike. As usual, you asked me, yesterday Ashwini asked me, sir, what should I do? How should I do? As usual, go to an orphanage, pay your fees there, provide some items. I'll not ask you what you are doing. It is your responsibility I'm giving you. Go there, take all the things worth 5,000 Indian rupees. I'm giving you a discount of 5,000. Go to an orphanage, buy some items, food items or whatever it is, and distribute among the children there. Yes, you know already, because Jennifer has already passed. I don't think I can share the responsibility to her until somebody else takes the responsibility in Nigeria group. That's it. And just pass on the information to you. Pass on the information to me. And just to take 1 or 2 pictures and send it to me. Nothing, even if I know that one, you will do that, everything. I know you very well. Just for my happiness, at least I'll see their faces. Okay. Next. Point number 5. Point number 5. Organization. This is another point. Order of merit. I'm just, something is coming into my mind. I don't know. I did not make any notes. Just something is coming into my mind. I'm giving. I don't know, but you know, all are important. Order of merit means which come in a paragraph. Which comes first? I told you, no, afterwards I'll tell you. In a paragraph, which comes first? Which comes next? Priority basis. Which comes first? Which comes next? That is called priority basis. Okay. First comes the condition, that is the problems or the diseases. Not just diseases, we can say ailments, cough, wheezing, chest pain, depression, hypertension, celiac disease, whatever conditions, sleeplessness, nausea, vomiting, incontinence of both urinary as well as fecal incontinence. So all these, or we can call them as ailments, not just diseases. Pressure, blood pressure, tensions, these are all ailments. Low blood count, obesity, undernourishment, low range of motion. Okay, it's a condition, ailment, sickness, disease, problem, whatever you call. Just one word I'm bringing it. It's ailments. First, you have to write what he has had hypertension. Next one, for which he has taken so and so medication. So first one, this is the order. First, you have to write what problem, and for that problem, what medication you took. Then along with this medication, what type of exercise he has to take. Many people write EXCER. I don't know why they write it. EXCER, no, EXERCIS, exercise. Exercise. Ailments, medication, exercise. Then you can say diet. Know all these things. Huh? Afterwards, whichever you don't want, you can remove. Diet, ailments means problem, treatment for that problem, medication. The next one is exercise. These three go together. First and foremost is problems. The next one is medication, exercise, diet. These three things are important. Medication, exercise, diet. These three things are important. Then other than this, what else? What else are there? Yeah. These are all during hospitalization. This will come in hospitalization only. Okay. All these things will come in hospitalization. What they did during the hospital, or what they should do after the hospital. So this will come in the second paragraph or third paragraph. Okay. But what you did in the hospital is not required. What they have to do afterwards, that is required. And they are sending the letter. So ailments, medication, exercise, then diet. This will be transformed from the hospitalization post-discharge. There also it will be there also. So what we did here, what you have to do there. Okay. Based on your observations, you are writing the recommendations or suggestions or advice. The next one. Reports. 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 Ailments. Some problem is there. You'll send for laboratory reports and you'll get the reports. Then you'll give medication. Okay. Then exercise, then diet. Then afterwards, dressing, the wounds and other things. Then next one, don't think that all these things which I'm pointing here will be there. Some will be there, some will not be there. Those are there, take them. Those who are not, which are not there, leave them. That's it. According to letter, it depends on letter, person, place, time, and situation. Every letter. Okay. Dressing. Then so if some situations like body mass index or obesity, like that. So all these things, right? Ambulation will go into exercise. Then lastly, ADL. ADL means activities of daily living. So these are the core elements. Order of merit I have given you. Follow this order. Okay. Follow this order. Upon admission, he has these problems. For that one, you send for X-ray or something else, blood tests. They revealed this one. So this was the diagnosis was confirmed. So we gave him this medication. And you asked them to do these exercises. And you asked them to follow this diet. Low-fat diet, gluten-free diet. Okay. Then dressing, regular, daily, saline dressing changes. Regular, daily, saline dressing changes. Regular, daily, saline dressing changes have been provided. If it is during hospitalization, if it is discharge plan, regular, daily, saline dressing changes have to be provided. Here have been provided, here have to be provided. Same sentence. If it is in a discharge plan, you are asking them to write like this. If you are writing in the hospitalization, what you have done, write here. But what you write here, don't write there. What you write here, don't write there. In discharge plan, write that one. In the third paragraph. When you are writing in the third paragraph, don't write this one here. Okay. So don't repeat the things. So write there. In the third paragraph. Ambulation. I'm giving you sentences here. That is what I'm showing you along with organization. If I tell sentences, nobody will come. organizations I'm giving, because this is more important than writing sentences. Many times I have given sentences. People think that they know everything. There's a problem. I have written so many letters, 10, 15, 16 letters, 20 letters I have written. I know your organization. Many things new you might have learned. So, ambulation or mobilization or ambulation for short distances. Ambulation for short distances has been possible without any external assistance. One sentence. Ambulation for short distances has been possible without any external assistance. That means his condition is very good. This many sentences I have told. Where is I, we, you, he, she, it, they in the letter side? The sentences I have told you. Then why in your sentences this many times they are coming? Next sentence. Mobilizing for shorter distances has been possible with the support of a wheelie walker. Write down. Mobilization for shorter distances has been possible with the support of a walking frame. So this is about exercises. That is about exercises. Mobilization, we go into exercises. Okay. Non-compliance with the medication. That will go for medication. If it is all the three. Okay, non-compliance with medication, exercise and dietary regimens has been noticed, observed. Reluctance. You can say if he's not interested. Reluctance with regard to smoking cessation has been expressed. Reluctance concerning smoking cessation has been expressed. He has already, no, I don't want to stop smoking. Okay, I'll reduce alcohol, but I don't want to stop smoking because it gives me peace of mind. Otherwise, I have too much headache at work. I'll go and relax. I don't know what relax they can get. What relaxation they will get. But they'll say like that. Reluctance concerning smoking cessation has been expressed. That's it. He is not interested to stop smoking. What is this and what is that? This is a first grade student. That is a 10th grade student. That's the difference. Minimizing the amounts of alcohol. Okay. Alcohol consumption. Regular alcohol consumption on social occasions has been mentioned. Regular alcohol consumption on social occasions, not frequently drinking, only on social occasions. That means parties, marriages, celebrations, meetings, like that. Regular alcohol consumption on social occasions has been notified. I want to know, I am teaching as if I'm thinking that you are writing, but how many of you are writing, I don't know. Are you writing in notebooks or not? If you are writing, say yes. I'm saying just frankly, accept. If you are not writing also, it's okay. If you are writing, then say yes, sir. And make the notes. Okay? Because I also forget all these things. They're just coming, I'm telling you. Make notes and just put it in our group or send it to Ashwini. Send it to Ashwini. She'll post everywhere. Or send it in the Christmas group. I'll send it to Ashwini and she'll post everywhere. Everyone will get benefit. It's not an ordinary thing. Minimizing alcohol consumption. Minimizing alcohol consumption and smoking cessation have been recommended, advised, suggested. Minimizing alcohol consumption and smoking cessation have been recommended. Not only smoking cessation, but also minimizing alcohol consumption have been advised. No, I, no, we, no, you, no, he, no, she, no, it, no, they. See the quality? Then why in your sentences I, we, you, he, she, they are coming? In your speaking, why they are coming? Whatever every sentence you are using, I can use it in the passive without I, we, who. I will teach you about insulin injections. The procedure for self-administering insulin injections will be provided. The information regarding self-administering insulin injections will be provided. Where is I? I will explain you. Why all these things? Empty vessels make much noise. Empty vessels make much noise. That means wherever much noise is there, it is empty vessel. Wherever much noise is there, it is empty vessel. So don't do much noise. No need too much. Little. Short and sweet. You keep a paper and leave it like that. Because it has no weight. It will fly in the air. You just keep a paper weight of that. You understand? It has weight on it. So what happens? It stays like that. So put some weight in your sentences. When you are saying, I will teach you about insulin injections. You. Eliminate. Who is teaching is not important. You is not important because already you know you're talking to him only. Why should you say you? So, passive voice. You don't understand the precious value of passive voice actually. That is what is relevance. The person who is doing is not relevant. Actually, I went into the 6th point. Okay. From dressing, ADL and all these things. That is a different thing. Personification. Personalization. Sorry. Not personification. Personification is linguistic. Personalization. Okay. Personalization is better in informal things. Friendly. Social things. Otherwise, it is formal, official. Okay. Formal and official. Did you see in any book, any textbook, any book, I, we, you, he, she, it, and they, in any of your reading or no? They will not be there because they are informal usage. Formal usage means subject centered. Subject centered means what is important? Insulin injections. So make insulin injections the subject of the sentence and put a verb next to that. So first word should be the subject. So it is subject centered approach. Subject centered approach. If you are talking about medications, okay. If you are talking about medication, okay, then you write about medication. And what you are going to talk about subject. What is the subject? In this particular sentence, this is important. That means that is the subject. Okay. Augmentin duo 40 has been described. This is subject centered. Subject centered. Not a doer centered, not a receiver centered, but it is the subject centered. Who is receiving this letter is not important. Who is writing this letter is not important. In the sentence, who is doing the action, it is not important. In the sentence, who is receiving this action is also not important because only one patient is there. Already everyone knows. It is already the subject of the letter itself. Subject regarding RE, we call it subject line. It's not subject of one particular sentence, it's the subject of the entire letter. Why are you bringing Lionel Ramamurthy into all the sentences and making Lionel Ramamurthy very cheap fellow there? Why are you degrading his power to every sentence? His level is higher, the letter. Why are you bringing him to every line, every sentence? Ramamurthy, he. What does that mean? It means that you don't know how to avoid repetition of the name of Ramamurthy and how to avoid the repetition of he. Either you are using Ramamurthy or you are using he. Both means you are bringing the subject which is already told at the top. Regarding Mr. Lionel Ramamurthy, that is repeated in the form of Mr. Ramamurthy or he. Why are you repeating? The biggest blunder, the cataract, you don't know that you are doing this mistake. Then how can we write, sir? Ask and learn. So you have to use passive voice for that. The doctor prescribed Mr. Lionel Ramamurthy augmentin duo 40. Now, doctor is there here. Lionel Ramamurthy is there here. Augmented UFO is there here. Now, in this particular sentence, which is important? Try to understand. Which is important? Doctor is not at all important. Because this is the case notes of the patient, not of the doctor. Everything related to the patient should be there, not related to the doctor. Why doctor's information will be there? No need. And patients, every sentence no need to go. Subject, finished. That is already important in the beginning itself. Then why every time you are reminding the importance of Ramamurthy or he? Avoid. Avoid. There are two types of people. Okay. Tigers fight alone. Wolves attack in groups. Or you're a tiger or you are a wolf. There are many people who say, sir, you are teaching differently, sir. Nobody is teaching like this, sir. You are wasting our time, sir. I'm least bothered. I'm least bothered. Because I know what is right. Yeah. I know what is right. The world before me. The world before me. The world is not on my side. The world before me. But behind me is the most powerful thing. Do you know what is that? The official OET. Because I take you, I teach you, I explain you everything based on official OET. Whatever you ask, I will show you in the official OET. I'm showing you everything there. And you cannot say no. And the second one is Cambridge Dictionary. The second one is Cambridge Dictionary. The strength is behind me. I don't mind. Why I am telling you all these things? To build a confidence in you that what I am doing. Okay. 99 people are eating groundnuts and throwing them in the train compartment or in the bus. 99 people are doing the same thing. And one person, Mr. Simon, because many times I have noticed this one, I have seen this one. I take groundnuts, okay, and I peel the shell and I put it in my pocket sometimes. And once the cover is empty, I remove from my pocket and put it in the cover. People say this fellow is crazy, see what he is doing. Yeah, for them it is crazy only. But I know that I am doing right, so why should I bother about others? Just telling you an example. 99 people, if they write, I am referring, Mr. Lionel, I am writing a letter to you. I am, there is one letter which blew my mind. I am writing a letter to you to refer Mr. Ramamurthy. Now see the standard of the letter. Now who is important in this letter? This letter is regarding whom? Ramamurthy. And where is Ramamurthy's position? Third position. Instead of making him the winner, you made him the loser. Because first prize is for whom? I am great because I have written this letter. Useless fellow. Why are you becoming important here? Who is important? Who is important? You are important. Or Mr. Ramamurthy is important. Why did you take the first place and the place of Ramamurthy to the third position? So I am great and you are great, but that fellow is let him be in the third position. What nonsense are you doing? Number one, you are not important. This is letter related to the patient. Why you are poking your nose into that? Mind you. Emancipate yourself. Now, what do you mean by emancipate? Emancipate. Emancipate. Emancipate means come out of the situation, come out of the condition. You are nothing in that. For example, if I am in the situation, what I will do like that? No. If I am in the situation, what I will do is not important. Keep yourself away. That means subject center. No. Object center. Now, what do you mean by object center? What it ought to be is object center. What is ought to be is object center. How it should be is object center. Okay. How it ought to be is object center. That means as it ought to be. It's not how it pleases. Today one doctor asked me, sir, is it important for me to print the paper? I told, you have to print the paper and write. She said, is it important for me to print that paper? I asked, in the exam, how are you writing? I'll write on the paper, sir, they'll give papers. So how you do there? Like that only you do. Sir, I did not know. Frankly speaking, this is the first time you are going to the exam. You did not write earlier. So first time, definitely write. Okay. But you already went to the exam, failed 1 or 2 times, but again not printing the paper and just doing on the computer or the phone. How does it match? It is just like you want to learn how to ride a horse. You want to learn how to ride a horse, and you are sitting on a wooden horse and just it's like a small child you are doing. Will you ever learn to ride a horse? That's the point. When you want to learn how to ride a horse, you have to sit on the horse, not wooden, but the real one. Practically speaking, application of intellect. I many times told you, when you are in Rome, be a Roman. In Hindi, there is a saying, apni manmani nahi chalegi. I will do as I wish. Type of attitude will not work. There is something called how you have to behave. When you go to Rome, Because Rome is not your grandfather's, mind you. Rome is neither your father's. The alarm bells are ringing. If you don't follow the rules of regulations when you are in Rome, if you say in India, I will do whatever it, you go to some other country, there you cannot throw paper on the road. Any paper or any plastic, you cannot throw it on the road. If you throw, you will go into the prison and stay for 1 full day. Now in India, of course, people do like that. What to do, crazy people, they do whatever they want, correct? No? I want to do as I want. Who are you to question me type of attitude? They know that they are wrong, but still they want to do, just because everyone is doing. Okay. My mother told when I was young, 5th grade, she told, if everyone is eating grass, will you go and eat grass? You are not everyone. You are you only. So you should have self-identity. These are all called moral values. But leave it, we don't go into that depth. But I brought them in front of you because these are called as standards. And now I am talking about OET standards. If your level is below standard, you cannot reach the standard of OET. Remember that. If you want to make friendship with first rank student, you have to at least come second rank. That's it. At least second rank. Then only he will make friendship with you. You should be studious. You should be hardworking. You should be intelligent. So, because there is a principle called like begets like. Like begets like. Birds of the same feather flock together. This is called like-mindedness. If OET and you are equal, then you will pass. OET's demand, if you give, if OET's demand is passive voice and you give active voice, your quality is less. OET demands C1, C2 vocabulary and you give B1, B2 vocabulary, it will reject. I know you understand. In the same way, when you are in Rome, be a Roman. Otherwise, Rome will throw you out of its boundaries or will contain you in a prison. In the same way, when you are preparing for OET, do everything the OET way. OET is a bus and you are a passerby. OET is running across the road and you are going this across the road. OET is going on the road from one side to the other and you are crossing the road from this side of the road to that side of the road, crossing over the road. And now I want it my way. OET will hit you and you are no more. You are in the hospital preparing again. Either the OET or me. Either the bus or me. It's not both the bus or me. Bus, I am safe. I, question mark. Be careful. Everything the OET way. Because, yeah, people are asking me. Many people asked me, Why are you asking me to print a paper, sir? Why should I spend maybe 1,000, 2,000 rupees for printing paper, sir? I'll tell these people. You are very wise. Read between the lines. I'm not talking anything negative, but you are think whatever you want. You are very wise. You are ready to forego 35,000 rupees for OET exam rather than spending 1,000 for printing material. There is the clear. Okay. So that's the point. Do it the OET way. Why I am telling you like that? But not only in the OET books, it is there. I have shown you in many of my sessions. Okay. Now, you are going for a running race, horse race, and you are practicing on a wooden horse. And on the horse race day, you are sitting on the horse. Where are you? This is a wooden horse, will not do anything. That horse will throw you down. You have practiced on phone. There you are practicing on paper. They are both different platforms. Okay. Both different platforms. In the house you are dancing. On the stage you are dancing. Lot difference. 100 people are watching. Your friends are watching. There's a lot of different impact on you. You understand? If you want to practice cricket, you have to go to the cricket ground and practice, not in the house, in the four walls. Learn the game, way of the game. Don't play your own. Don't manipulate the game. Preparation is a game. Don't manipulate the game to suit your own helplessness. Who will print the paper? Sir, I don't have anybody to print the papers and bring for me, sir. I am helpless, sir. I don't have anybody, sir. I am in a hostel, sir. Why are you giving me excuses? If you cry like that, am I going to print and give you? Tell me. A person who gives excuses is already accepted that he is a failure. That's it. Only a person who knows that he has failed is helpless. He cannot do anything. Okay. This person is not only failure in printing papers, is failure in every activity of his life. He doesn't get up early in the morning. He doesn't sleep in the night. He doesn't eat timely. He doesn't do everything. He doesn't fold his bed. He doesn't do it. He's a permanent failure. His life itself is a failure. Such persons only give excuses to avoid actions. And a winner, successful people don't do different things. They do things differently. Sir, how should I do? I have my computer, I have my phone. Now what? How? Tell me, sir, how I should do? Then I say, you have to print the question papers and keep them. You have to print the question papers and keep them. And every day you have to take those papers and, okay, sir. Agreed. Give me material for 1 full month, sir. I'll print and keep them. Every time I cannot go. This is what is called successful attitude. You understand what I'm telling? The problem is not with OET. The problem is not with printing material. The problem is within. It's not collateral damage. It is internal damage, already damaged, brain damage. This is. Okay. It's a personality disorder in your medical terms. They don't know what is important. They don't know what is good. They don't know what is right. They don't know. There's judgmental attitude. They don't know. Some people, what they say, this Simon sir has no work. He always tells me to print the papers and keep them. And why should I print? This is again something else, finding fault in somebody else. Blaming somebody, finding fault in somebody. So don't tell all these stories to me. Why should you tell me? Suggestions are mine. Decision is yours. You are not in a position to decide on yourself. So I am giving you some suggestions. At least after taking the suggestion, decide. Nah? I'm not talking about any particular Tom, Dick, and Harry. I'm talking in general. It doesn't apply to any one person. It is any person, even to me. So change your attitude. If something, to tell you one thing, the main reason for failure in this world is, okay, 3, trident. Trident. She was trident. Javelin is only single arrow. Trident has one long stick and 3 fork like trident. Fork is a trident. You'll have 4 for eating, cutting, knife, fork, and spoon. Go to a hotel, they'll give all these things. Trident, 3. So poke them, 3 pointers. First one is mistakes happen because of 3 things. Failures happen because of 3 things. First one is ignorance. I don't know. Is ignorance. Lack of knowledge is not an excuse. Morning you get up and walking, or you're closing your eyes and walking, or you're looking at your mobile and walking, and you're walking on the road. Somebody dug a pit to put a drainage canal there and pipes there, and you fell into that and you broke your bones. Why you fell? I don't know. That ignorance is not an excuse, because ignorance by default it punishes you. You touch a fire, I don't know. Somebody will keep a burning fire. We see a lot of pranks these days. Pranks. Okay. They put something there. You are eating something. Some cakes or biscuits are there. And that fellow will come and remove the biscuits and put something. Okay. I don't know. Somebody has put. You are eating and you are just taking from there and put. That fellow removes that chips and put chilies, green chilies. Prank. I don't know. Why did you keep them side? Keep them in front of no. Every piece when you are taking, take it, and I don't know. Ignorance is bliss. But by default, it is punished. Don't say, I don't know. No, it. The doctor asked, what should I do? What did I should do, sir? Then she said, I will print, sir, send me all the books. That is the difference. Personality transformation. Behavioral modification. These are all psychological terms because we learn all this psychology. I told you already, I'm a university first rank in psychology. Okay. Behavioral transfer. Inside it is damaged. So outside, how you will be successful? Okay. You only are seeing outside. You are not seeing within you. The damage is within you, not outside. Sir, they are giving, I'll give you one funny example. They are reading very fast, sir. They are speaking very fast, sir. Sorry. You are catching very slow. You are catching very slow. Okay. You're telling, I reached, the bus already left, sir. I went to the bus stop, but the bus already left, sir. No. After the bus left, you reach. Don't blame the bus. It is your problem. Why did you not start early? So this is what is transformation. You change your style. Okay. Instead of writing whatever you want, which should come. Don't take only 45 minutes and write. Nah? Okay. Sir, I took 45 minutes, sir. 40 minutes and I wrote, sir. 5 minutes I read and 40 minutes I wrote, sir, and I'm sending. This is not the game. After writing, keep it in front of you. Take another paper and now leisurely improve your letter. That is nonsense which you have written in 45 papers. Are you writing in the exam hall that you don't have even 1 minute extra? Where is your common sense? Take it, Simon, sir. You don't have any work. Come on, correct it. As if you are giving $1 million check to me. It is going to blast my head. You don't know. Keep it in front of you. Take another paper. Sir, I don't have time, sir. Then why you prepare for OET? Go and work in the same manner. Na? Life punishes you before it tests you. Remember that. Life gives experience to you. Understand? But before that, it tests you. It punishes you rigorously. So be careful. There is no excuse for this one. Now what you have to do is take all these sentences from whatever lectures I have given. Keep those in one paper. Here. And this letter you keep left side. This my sentences you keep there. An appointment for review of medication, ongoing medication, at so and so time, on so and so date, in so and so place, has been scheduled. Now compare this and compare this. One sentence. Already you wrote all the sentences. I corrected many letters. Take all the letters and others' letters. I corrected one letter for that Neha girl. Neha Banu. And I corrected another letter for that Opula Srilata. I corrected another letter for Meera Manoj. I corrected another letter for Rajya Lakshmi. I corrected another letter for Lanai Bhakti. I cannot take all the names, but I corrected many letters of many students. Why don't you take those letters, print, or in that letters, write down the sentences which I corrected, which you felt very great, very excellent, which you can use, and write them on the paper. Like that 100 sentences you write, you don't need any preparation at all. You don't need any preparation at all. For medication, what sentence Simon sir wrote? Passive voice. Write that sentence. You keep this one and write that sentence. See this sentence, and these two relate, correlate, and write this sentence. That means you have improved your own letter. Do you want mistakes or do you want improvement? This is called attitude transform. You are looking straight like this. Sir, correct my paper. Sir, correct my paper. Sir, correct my paper. Like a horse going out like that. Why this is blindfolded? Why this is blindfolded? Because if you see this side, here grass will be there. If you see this side, grass will be there. Then this horse, instead of going straight, it will be pulled towards eating some grass. Try to understand what I am telling you. See this paper, one side, left side. This is your road, you have to go. But see this grass, you will know what you have. This is weak, this is strong. Now this weak is transformed into strong. You cannot write everything of this. So use this one and apply this one, and whatever are applicable, take from there and write here. I told many times, people will not listen. We don't have time, sir. Why should we write all these things, sir? Just well, write like that. Every time we do mistakes, every time you correct. This is a non-stop nonsense going on, going on, going on. So far, these 4 months, I have seen only 2 students, and I told them on the platform and here personally also. 2 students, lot of improvements. One is Meera Manoj, and the other one is what's the name? I don't remember that. Makaranam, something. 1 minute. I don't remember. Excellent. Whatever I tell as it is, they will write. I don't know what they are doing. I don't know. They will think, but I know what they will do. These are the 2 students who have written very wonderful. Very wonderful. I try to, with great difficulty, I try to find mistakes. And just now I have seen another lady. What is that girl's name? Nasra Muhammad. On the platform, I told her today, what is that? I am not a people pleaser. I don't mind whether anybody likes me or not like me. If they say, Mr. Simon, you are a dirty rascal, no problem. Because I know whether I am dirty or not, I know whether I am rascal or not. So no need, nobody need to prove me. I am not insane. I know what I am. Fact of the matter is, I know what I am. I don't need somebody to tell me what I am or who I am. So this lady, Nasra, I was literally shocked at her sentence. You know what? Don't I know the style? If you sow grape seeds, grapes come. If you sow weeds, weeds will come. If you sow bananas, bananas will come. Don't I know the rule of progress? You sow weeds and grapes come, impossible. You sow banana and apples will come, impossible. That is the fact. A person who is doing extraordinary hard work, the output will be extraordinary. The dedication, the hard work. I'm not depreciating anybody and I'm not praising anybody. But the fact of the matter is that. Why did I not call somebody else's name? So many sentences I have read. Why did I tell only about Nasra's sentence? That is the point. When I say something is wrong, that is wrong. When something is right, that is right. This is gray hair. This is just gray hair. Many of you people might not even have the age of my experience. And some people come and, sir, teach me like this, sir. This is better, this is better, this is better. You don't have English background, you don't have teaching background, you don't have subject, you don't have experience. You will come and teach. It is just like the egg coming and teasing the chicken, teaching me how to do something. Eh? You are going to fail. You already failed 2 times. And you will come and tell me, you also failed with me. I will tell everyone that I studied with you. Still I failed. That means you are a useless fellow. That is what you want to proclaim to the world. There is one crazy idiot. He wrote what, you know? I told this. I'm a certified Cambridge University. I'm certified by Cambridge University. That fellow wrote on the, somebody showed me, sir, this fellow wrote like that. Let it be like that. Keep your Cambridge certificates with yourself. So I don't mind. Nothing is going to happen for me. Okay. That fellow is not even half my age. He doesn't have anything. He doesn't even pass OET. That fellow is coming and teaching a person and telling some mistakes about a person who is teaching. for almost 3 decades, 3.5 decades. Okay. So that's what it is. Empty vessels make much noise. I did not say anything. I said, okay, I'll keep my certificates to myself. I cannot give to anybody because I paid, I sweated, my hard work. 2000, I paid 1 lakh rupees for that. Just for that certificate, 1 lakh. And I did not fail. I passed. Okay. So what I'm telling you is change your attitude. Somebody is putting, you don't know my situation today. Very, very, very pricking me also. But still, why I'm telling you, you are very precious to me. Because without you, I am not there. Without you, I'm not there. Because you are my essence. Student is my essence. You are very important for me. So I'll give you the best. Apply all these things in your OET. Forget it. You will forget me after 1 month. No doubt regarding that. I'm not your entire life. Okay? When I'm telling you something, the problem is not with your OET. The problem is not with your reading. The problem is not with your listening. The problem is not with your writing. The problem is not with your speaking, your vocabulary, your grammar, and the problem is with you. How you are looking at things is the problem. Change. Turn the tables, and you are the winner. And don't, for anybody else in the world, don't change your standards. Don't change your, what you think may not be right always. You cannot think about another person. How can you think about OET? You cannot understand your own brother. Okay. He is facing some difficulty. Then how can you think about OET? Problem is with you. Okay. Problem is with you. Change your style. And I want this batch. I want this batch. I don't want any failures. I don't want any failures. I am going to be there with you. Morning 9 o'clock till night 12 o'clock. I will be there. And when I say yes, it is a yes. Okay. Now I'm telling you, I'm not going to leave you this batch until you clear your point. 9 to 12 night, 15 hours. Everyone will do 8 hours duty. But I'm going to do more than 15 hours duty. But still, don't say, sir, I'm not there. You're not giving me. Don't say, I'm here. Just knock the door and get things done. Okay. So, and the next one is 6th point. Sixth point is superficial. Superficial. What do you mean by superficial? Actually, this is the last point, but this is the first point according to me. People bother about this the least. This is called a presentation. Presentation. Some people write dirty handwriting. Dirty handwriting. You see, if you see garbage, no? If you see garbage, you'll get like puking, vomiting. Okay. A good person, a good human being, if you see garbage, automatically from the stomach, everything will you throw out. Then a teacher like me, I'm talking a human being about garbage. is as garbage to a human being is same like a dirty handwriting to a teacher or a student. Dirty handwriting is garbage. And I feel like, my goodness, I don't know what to say. Presentation. What is a presentation now? Presentation means when you look at a letter, you won't read anything, but without reading even the first word, just glance at it and you should say, wow. Now, what are contained here? This is a part of presentation. Okay. If somebody you want to go and talk, and that somebody is sitting like this, and you are coming, tell me. You don't feel like you're talking to him only. Useless fellow, I came to talk to you and you are behaving like this. And what should this teacher say? Useless fellow, you want me to correct at this sort of dirty handwriting? I'm not talking nonsense. And you know it very well. The fact of the matter is presentation. What will others think about you? What image you are giving to the person who is going to spend at least 10 minutes to 20 minutes correcting your letter? And this mad fellow, Simon, he'll correct your letter for 1 hour. He will not even get vexed. If you give the same letter to somebody, they will say, I don't want to correct this letter only. But patiently, I'll be correcting your letter, but no change in you. Same again, another letter also, same things will come. But still patiently, I'm correcting. I'm not telling you how much pain it will be for the person who is correcting. I tell you, submit your timetable. You don't want discipline? Then how will you win the war against OET? Where is that self-discipline? Even before I tell you, I know the people who have prepared a timetable without my knowledge. They told, sir, this is my timetable. Sir, you can call me only on this timetable, this time. This is my regular routine. Morning, I'll get up at 5 o'clock. And 5 to 6, I'll do listening. 6 to 7, I'll do reading. 7 to 8, I'll do writing. Then afterwards, I'll prepare myself and get ready and I'll go 10 o'clock to my office and come back at 8 o'clock. In the evening, you can give me my sessions. This is a perfect timetable. Planning, preparation. Finally comes presentation. Okay. So what are included in presentation? I don't mind. Many people will go off. I don't mind. It's not our problem. My problem is to tell even if one student is there, I'll tell. So, because that is the reason why people are failing in the exam. There are some doctors, you know, doctors' handwriting. They fail writing 5 times, 6 times. They don't know that their handwriting is the problem. And OET will not tell that handwriting is the problem. There is no face-to-face or mouth-to-mouth discussion, interaction between OET and anybody. And this fellow will never know why he lost his mark. That fellow will never give why, explain him. Those are poles apart. I am the gap between now for you. What OET wants, I am telling you. Okay. And what you have to do, I am telling you. I'm trying to make both ends meet. I am standing in the gap, but you feel that I am a fool. You are telling so many things, sir. You are preaching, sir. You are teaching, sir. We don't have time, sir. So don't come to me. Na? One, there is something saying. A person who has wisdom, he doesn't need anybody to tell. He is self-intuitive, self-disciplined. A person who does not know, somebody tells. And a person who is there, he improves. I know everything and I am doing it correctly and I am learning everything perfectly. I am managing. Self-discipline. Imposed discipline. I am telling you, put a timetable, do this time, do this time, do this time, do this time. You don't have that self-discipline. And somebody is trying to discipline you. I am not great, okay? I am a very ordinary teacher. Okay. So I am telling something to you. You don't have discipline and you will tell, sir, you are taking this time. What is your timetable? I am always on the timetable. Morning to evening, I am always there. My timetable is going on there. Who is there? Raise your hand. Come, I'm taking speaking session. Whenever you are there, ready, come, call me, message me. I'm always there. So, somebody is telling, change. Some people self-discipline. Some people imposed discipline. And what about the third category? What you call them? You are the better person to judge about them. Because you are very clever. You're doctors and nurses, you're very clever. I don't need to tell you what type of people this third type of category is. These people who don't have self-discipline, I'm not talking about anything in your life. I'm talking about discipline regarding studies. Because I'm a teacher, it is my responsibility to tell you. Okay. So self-discipline or imposed discipline or anarchy. Anybody, whatever you want, you do however you want. Type of attitude. I will do when I have free time, sir. Today I don't have time, sir. So I am sorry, sir. Why I should be sorry for you? Who is not sorry for yourself? You don't respect yourself. Why I should bother about you? Sir, you are not calling me, sir. You are not telling me to come and attend. Why should I call you? You should shoulder your responsibility for yourself. You just say good morning, sir. What will you do? Just 1 second. Good morning, sir. I don't get a crown for that one. I'll tell you. Come on. Come on. Where is your timetable? I'll tell immediately. What did you do today? When is your duty time? Something I'll plan for you. When you say good morning. Hmm? Just in the group you say. Put your timetable I'm following. When I say, raise your hands, those who are ready to speak. They raised. I take speaking session. Raise your hand for correction. I'll take one by one. What to do? The people who are not ready to improve, they are not ready to do hard work. They are not ready to rough draft into fair draft. What you are writing for 45 minutes is rough draft. Why don't you take it? All the examples, there are many examples. You have written what today? Miss Mary Bell. There are hundreds of letters which we have corrected there. In 3 different forms. One is Simon corrected, one is Peter corrected, and one is Grandmaster corrected. Now, what is the Simon corrected? What is Peter corrected? What is Grandmaster corrected? Level 1, level 2, level 3. The first one is manuscripts corrected. The second one is without a Grandmaster class logo and photo. The third one is with my photo. 3 levels. You can take any one, different persons' letters, and check those sentences which I corrected there. In every letter, I have given at least one sentence. If you go through all these letters, 100 letters, you'll get 100 sentences. Just write those sentences and keep them next to you. Medications, 1 sentence. Exercise, 1 sentence. Dressing changes, 1 sentence. Non-compliance, 1 sentence. Write and keep that. Nah. This letter which you have written on your own, take this one and modify this one. This what you are modifying will go into the next day. Where is your hard work? Every day you are writing one OET letter as if you are an expert. And just you want me to correct. Actually, you are killing the time of 3 or 4 other students. If you practice like this, I can correct in 1 hour, 4 or 5 letters. And one student is taking 1 hour each. You don't know the pain what I am facing. And nobody else will correct like this. And you don't understand the love of somebody who loves, whose passion is teaching. Very sorry for that. You are like that child, who drinks the milk of mother and blasts the head at the mother's breast. Some students. Okay. I'm a mother for you. And you kill my passion for teaching. Sometimes I feel like I don't like stop teaching. Why it is 53 years of age? Why should I struggle with these people who don't have that fire in them to excel? I feel very sad. Seeing these stupid people who teach nonsense, I feel very sad. How am I a teacher with along these things? That is a teacher and I'm also a teacher. What is the difference between that teacher and me? Okay. People are selling glass pieces and taking the prices of diamonds, and I'm ready to give diamonds for you, and you are throwing it away like glass pieces. I'm not bothered. You are very precious to me. My bread and butter depends on me. So how much importance I give to you. So transform your presentation. Why many letters I don't correct is because of presentation. 1 letter I correct, 2 letters I correct, 3 letters I correct, and there is no change. What should I correct again? 1 hour it's correct. They say, sir, you are not correcting my. How many times I've told you, improve. What I taught earlier, why don't you change? After 1 month, after 15 days, still the same 1 hour you are taking for my correction means. What is the use of your study? Every day should be progress. Every second should be improvement. Change it. First one is margins. You are a doctor and you are a nurse, and I have to tell you that you have to write from top to bottom in a straight line. Huh? Am I a nursery teacher for you? Am I a nursery teacher and are you a nursery student? Should I tell you that you have to write left to right margin? Okay, you did not learn from that time to this time at least, and now I am telling you, Number 1, margins. Today's lecture, you follow all these things. Who will stop you from getting A grade? I will see. Challenge me if you can. Because that's the ultimate. What all I am telling you now, implement these things, and that is called success. Margins. Then second one is called foundations. Now what are these foundations? Foundations means every letter should stand seated on the line. Every letter should be seated on the line. Some lines will go up. Some words will go flying in the air. They are flying like birds. Some words say, I'm drowning, save me. Half up and half down. Only face is up. Save me, to shout like that. Some letters are drowning. They go half down and half up. Sinking. Okay. Is that right? That is called foundations. Then the next one is called the roundings. Don't think you will get all these things. These are my own coinage. The roundings. What do you mean by roundings here? Every letter should be round. Round. But what some people do is they make sandwich Some people make them chapati, pancake, corners. They don't know chapati maybe. But nowadays Indians are everywhere, so they know how. Some people make sandwiches. Press it. Then only it will go into mouth. No? Compress like this. Okay. Vertical. They compress the words like this. Okay. So the words are not very clear. And some people put a iron box and press the clothes like that, and they'll compress. We don't know. We read now. We face all these problems. Every word should be like rounded letters, round letters. And the next one is spacing. Spacing. Now, what is this spacing? What is this spacing? Spacing means between two successive letters, there will be a small slit from top to bottom. You can put a paper between them. Like two cars are there. When you park two cars side by side, there will be a small gap where a person can go in and open the door and get in. Okay, that's called a gap. It's called gap. And what some people do is, they put a favicol to these two words, shoulder to shoulder. And we don't know what it is. C and I are joined, it becomes U. It becomes U. C and U are joined, it becomes W. B and L are joined, it looks like a L and D, or LOL, or BOL. I don't understand what it is. I will only scratch my head and I'll tell. I don't know what to tell. Why? We have come to graduation, finished graduation, and you are writing a letter for somebody, Mr. Simon, to correct. What do you think about Mr. Simon? Instead of helping him by providing and making his face happy to correct better, you are writing dirty handwriting and this rotten handwriting. That is number 4, spacing. Between two letters, spacing. Okay, spacing. So important lecture I am telling you, some very important things I am telling you with all the depth of my heart, and half of the people have gone. That means, try to understand, only the worthy will get the best things. Okay, right? After marriage, everyone will go. Only the family members will be there, because those people only love you the most. Guests are guests. These people who come off and on, they are guests. Okay. Those people who love to learn, who love English, who love to learn, who love to change, who love to improve, they will be staying in the last. This is life. Whatever I'm telling you is not just like that. It comes out of experience. So next one is spacing. Spacing between two letters. Spacing between two words. Between two words, there should be a single letter space. Between every two words, there should, what we have to learn in LKG and UKG, we are learning now. Because your teacher did not bother about you, or you did not bother about the teacher, or both did not bother one another. That is not my problem. I bother. If you don't bother me, that is still you will repeat the same thing and your presentation will never change. It is like a dog's tail. It is like a dog's tail. Okay. It will never straighten. So we are least bothered about that. So we have to transform everything. Okay. There are some people who try 4 times, 5 times, but still they don't change their style. They just go and try it because they have money. You don't understand. One time you get hurt only, you'll be very careful. Okay. You are trying some medicine, it is not working. Again trying some same medicine, again it's not working. Again trying the same medicine, again it is not working. Then what is the problem? Where is the problem? The problem is not in the medicine. The problem is not in you to throw away that medicine and take some other medicine. The problem is not in the medicine. The problem is in you. So spacing between the letters, spacing between the words. Many people don't know that they should not leave space before comma. Many people do not know that they should leave space after comma or after full stop. How many times you might have heard me saying all this? Is this what I have to tell you, space before comma and space after comma? Huh? For a person who has completed 15 years of studies, or is that the reason why you are paying me money? Actually, I cannot do like others, so I am explaining, but still you don't change. Again, another letter, you will do the same. That's the point. Spacing between 2 words, 1 letter space. 1 letter space. And never write in the left margin, never write in the right margin. Even if you don't have space, and even if you write 1 word also. The last dot, till there you write and leave it. Otherwise, before only write. Otherwise, if you don't know, leave it, write in the next line, no problem. Nobody is punishing. Why do you want to use the empty space, white space, where there are no lines? If that space also is finished, you will write on the table and pack the table also and give it to the examiner to evaluate. There is something called margins. He is telling you this line is starting here, this line is ending here, and line is finished. Still you are writing. Presentation. Your paper should be like a bride on the wedding day, flawless. Then happily the other person will correct. I'm not bothered about myself. You are not my life, you are not my everything. You are just a part of my life. Okay. If you pass in the exam, I'll be happy. If you fail in the exam, I'll be sad. More than that, nothing for me. Okay. You're not my entire life. I am not worthy to cry. You're not worthy to cry all my life if you pass or fail. All my life, I'll not be happy that you passed and tell everyone like you pass. After 1 month, the relation is finished. Once you finish, you'll not even remember. There are many students who after passing don't tell the result. Yesterday, one student left the group and I asked, what happened? And I said, I passed, sir. Too many messages are coming. You did not have the courtesy to tell me that you passed. I felt ashamed. I could not create a space for her in her heart for me to tell at least that she has passed. So spacing. Next, spacing between the paragraphs. He's telling you this line is starting here, start from there. Why are you leaving this much space and starting from here after the line? Many people I tell when I am correcting the letters, come. Why don't you come and learn from others? Again, you do the same mistakes. Many people, they correct the letters, they do. Nobody know that they are correcting the letters. They just to keep them for themselves, your teacher and the student knows, nobody else. But I am putting everything there. So next one, paragraphs. Every paragraph you have to leave one line. Every two successive paragraphs, one first paragraph, second paragraph, between them, you have to leave one line. There are some students who don't leave line. How do I know that you have started a new paragraph? How do I know? Yeah? How do I know that? Your house and neighbor's house. In between, there is a compound wall. They will not cross this boundary, they will not cross this. But what are you doing this paragraph and this paragraph? Side by side you are writing. How do I know where is the boundary of this paragraph? How do I know that another paragraph, another concept? How do I know that upon admission and during hospitalization started? I don't know when, because I can see only this beginning upon admission. During hospitalization, I cannot see because it is merged with the previous line without any space. This is very important. Okay, this is very important. You are eating food, but your plate is dirty. You are eating food, but your plate is dirty. Yeah? Mind you. So plate is more important than food. And you ignore the plate itself. And you don't keep it clean. Presentation. I don't know. I'm giving diamonds. But many people feel that they are glass pieces. They don't have time. They have more important things. They have more than that, diamonds. The next one is spacing. Yeah, neatness. Neatness. Now, what do you mean by neatness? If you are UKG child, if you are a UKG child, you have written some mistake and you have struck off with pencil and wrote next. Then you will tell them, you have an eraser, no? Why don't you rub this one? What do you mean by this one? Are we not applying our common sense for small things? Why are we not applying our common sense for even small things? And we boast ourselves that we are doctors, we are nurses, and we are not in a position to apply small things, our common sense. That's the point. Neatness. Neatness. Because my shirt is very white. I love white shirts. Okay. I love white shirts. Top to bottom, I used to be white before marriage. Afterwards, it became diluted. But now, white shirt. Complete white shirt is white. But something is dirty here. Everyone's eyes will go there only. They will not bother about the 99% of the shirt, which is pure white. Everyone's eyes will go there only. What do you mean by this? You understand? That means dirt attracts more comparatively than neatness. Remember that. So better clean it off. Your paper is very nice, but somewhere that only comes there. They will not see all the 100% paper. They'll see only that one. Even if I see what I am doing, you have written 200 words. 200 words means how many characters? One word is 15 letters. One word is 5 letters. One word is 10 letters. One word is 1 letters. So 1 plus 5 plus 10 plus 15. Let us make average. 1 plus 5, 6. 6 plus 10, 16. 16 plus 15, say 31. 31 by divided by 4, 7.5. So 7.5. Let us take 6 because we don't write big words. No, we are great people. We are great people. Actually, if you write C2 vocabulary, your 2 pages will be filled. If I write 1 line, only 3 words will come. If I write the same thing, what you are writing, in 1 line, 3 words will only come. But there are people who write 12 words. That means you can understand the size of the letters. Okay? Right? Absolute medication compliance. Full line will be filled if you write properly. I'm just giving you an example. Okay, don't take that one as a fixed standard. All right. So what I'm telling you is that is why 2 pages are there. And what you do is you write 200 words, and those 200 words you compress, and you write small words, and you fix it in 1 page itself. And because Simon Sir tells, you will write 4 or 5 lines in the next page. There should be only 200 words in all the 4 paragraphs, excluding the conclusion. And you have to go till the 2nd page. Okay, that is the standard. 200 words doesn't mean a, am, that. He. 10 times you wrote he. Out of them, 9 times he is not counted at all. That means it is no value. He is testing your vocabulary and 9 words are he, which are repeated, means what is your quality? Low quality. And you want the OET to make you pass? And there are some people who are begging now. Bring the score to 300. And they got it accepted. Okay, 300. Now 300 pass enough writing. Okay. And now they're saying 250 is enough also. They will write another petition afterwards. That also they can get. They'll say 250 enough. Quality. Neatness. Then next one. Legible. Now, what is neatness and what is legible? Neatness means when you look, there is no dirty spots here and there. Legible means readable. Somebody can read it or not. This is total. These are all different things I am telling. I tell many times what? Sir, I have written T, sir. I think, where did you write a T? A UKG student is better than you because you don't know how to write T. T how? Like this. L dash. Sometimes no dash. Sir, I wrote like this, sir. Hurry, that line did not come, sir. And somebody will write like this. Somebody will write like this, and somebody will write like this, and somebody will put like this, and somebody will put like this. This is T. What is T? Always cross the T and dot the I. Dot the I. Where is I? Sir, this is I, sir. Where is the dot? On the neighbor's head. On the neighbor's head. The person, the letter next is there, no? That letter on the top, it went there. That means instead of feeding your mouth, you are feeding to the neighbor's mouth. The food you are taking, putting into your mouth, you are putting into the neighbor's mouth. There is a story. Okay. The king called everyone and he wanted to teach them wisdom. Okay. He wanted to teach his wisdom. He said, I am putting laddus in front of you, but you should not bend. You should not bend. He made everyone to sit in a circle. Then you should not bend your like this. You should take like this and you have to put in your mouth. Okay. Then what? In that one person was very clever. He said, he did one thing. He did not tell anybody. Successful people do different things. No, successful people don't do different things. They do things different. So what did he do? He took that laddu, sweet, in his hand. And what did he do? He put it in his neighbor's hand, neighbor's mouth. Then once he did, this fellow did, he did the same thing. No, everyone did the same thing. So like that one it is. So this dot, which should be on this head, you are putting here. What does this mean? Where is I? Do you think that it is I? It is considered as a spelling mistake. Don't think that you'll be. Okay. That is why many people are failing in OET reading part A because of this nonsense. Do you know that you have been made to put part A like that, to write like that? And many people think that they are failing because of part C. People who are failing because of part C are getting, okay, 280, 200, below 300. Below 300. Okay. But those people who are failing in part A, they are almost at the doorstep. 340, 330, those people there. Just 10 marks, and those marks cut there. You don't know that because your spelling is not clear. Okay. And those who are applying for revaluation, instead of getting 10 marks, they are losing 10 marks because of those things only. They say, sir, I applied revaluation, sir, they cut again 10 marks. Sir. There are many instances like that. They check deeply. If you are getting marks, they will give, no problem, no doubt regarding that, because they are like that only, because senior personal revaluation. Okay. Just because of your handwriting, you are losing in part A, listening and reading. Don't think that it is a joke. Writing answer is not important. Writing answer the right way is important. You prepare chapati or curry and put it on the table, nobody will eat. Or throw it like that one, scatter. Everything put like that and make it dump and give, nobody will eat. Even your husband or your wife or your son or your daughter, mother, nobody will eat like that if you mix up everything and nicely plate is decorated. Understand? So decorate and give to those people. Legible means it should be readable. Okay. Just now I told you. L. What is that? B-O-O-K, book. B-O-O-K, book. Okay. B will be separated, L and separated. It's not clear. They are not joined. Okay, L and T, we don't find any difference. V is written like U. U is written like N is written like U. They don't know how to write N. Many people, they don't know how to write N. I have shown you in the, go and see my videos. And these people want to pass OET. Don't know how to write N and pass OET. ABCDs are learned in LKG, UKG. And I am teaching that also. But again, they will write like that. That is the fact of the matter. So, legible, right? Okay. So that the other persons can read it. So that the other persons can read it. The next one is punctuation. What do you mean by punctuation? Capital letters and small letters. Why there is a difference called capital letters and small letters? Why you write some letters tall and why you write some letters small? Because they are like kings and these are like soldiers. And what you are doing, many people are doing, capital letters are also same height. They are writing capital style only, but they are putting the height same as this one. Or they will go and touch the capital letters are going and touch the previous line. How can you touch the boundary? How can you touch the previous line on the top? Base seated, okay. Why this capital letter when you are writing M is going and M2 shoulders going and touching the above line? So concentrate on those things. That is punctuation. Punctuation, lot of punctuation. Spacing is also a punctuation here. Punctuation marks, full stops, commas. When it should be there, full stop, immediately after the word. When should be comma, immediately after the word. But what you do is, you'll leave space, then put comma. Afterwards, no space. Some people, what they do, they'll keep equidistant, means in the center, they'll put dot. I've shown you many times. Check my corrections, you'll know. Manuscripts. That is the reason why I tell you to write in manuscripts. In the first week, I'll tell you submit in manuscripts. Then afterwards, I'll tell you type it and give me. Why should I type, sir? You don't know if you type what benefit you are getting. First thing is when you are typing, you will learn at least, oh, here I did a spelling mistake, that's spelling mistake. Because you are not revising, you are not rough draft, fair draft, you are not doing. So I try to do something and that also you will not do. Right. New students, follow all these things. Don't follow the footsteps of the old students. There's an old saying, you cannot eat the cake and still have it. You cannot eat the cake and still have it. You can either eat or have. That means you can keep it in front of you or you can eat and forget it. You eat it and you still want, I want the cake. It's impossible. There's only one option. There's only one option. Okay. You understood what I'm saying? So transform. So 1, 2, 3, 4, 5, 6, 7. So that is the sixth one. Number 7. Last point. This is a very dangerous point which I'm going to tell. Yes, Rakil. Yes. Okay. So, now let us see here. 7th point. 7th point is time management. Time management. How much time I should use for introduction? How much time I should use for conclusion? And how much time I should use for each body paragraph? You should know. Now you have 40 minutes. You have 40 minutes. 3 main body paragraphs and 1 introduction and 1 conclusion. Others, you don't need much time. Okay. You don't need much time. Copy, paste, write them. Don't need much time. So let us consider this one. So now, 3 main paragraphs and 1 introduction, 1 conclusion. So 1 introduction and 1 conclusion. 3 main paragraphs. Now see, 40 minutes. 5 minutes you cannot do anything, not even touch the pencil. So now this 40 minutes. 10 minutes, 10 minutes, 10 minutes, 30 minutes. Now remaining how much? 10 minutes. So 5 minutes, 5 minutes. 40 minutes. Okay, fine. So 40 minutes. That's it. 40 minutes. Introduction 5 minutes. Conclusion 5 minutes. Introduction 5 minutes. Conclusion 5 minutes. 10 minutes gone. Body paragraphs 10 minutes, 10 minutes, 10 minutes. So total 40 minutes gone. I'm planning for you now. Now what you do is take 1 minute from this, take 1 minute from this, and take one. Don't take 1 minute from this. Only these 3 take 1 minute each. That means 9 minutes, 9 minutes, 9 minutes. Now these 3 minutes you use for address, date, salutation, and subject line. And last, farewell greeting and sender's particulars. Finished. This is called time management. Time management. Now, time management, I'm going to show you how we are going to divide the time. Actually, there it is 5 plus 40. So forget that 5. Forget that 5 minutes preparation time. In the 40 minutes, 5 plus 9 plus 9 plus 9 plus 5. Okay. These are the body paragraphs. And there 9 minutes are there. 1 minute you have removed. No? Those are for the extraterrestrials. You can use. This is for the body. And the rest, 3 minutes. So 37 minutes. 3 minutes. You should know how much time you have to spend for each one. Without time, you cannot manage them. Sir, they pulled my paper, sir. They asked 2 minutes you give me, they did not. Why should they give you? Why should they give you? So 7 points I have given. 7 points. But this last 2 are very important. Because if they are not presented properly, if their time is not managed properly, okay, you will not reach your goal. And most importantly, you will not get marks if your presentation is not very good, because the impression of the person who is writing, he has 3 types of impression. He will say, wow. His mind will say, he will not say loudly like that, but he feels in his heart. Wow. Feeling. Because I'm a teacher, I know what I'm doing. Immediately I say, there's a smile coming on. Look at the paper. This paper I should correct first, like that. That means it's a wow. Then the second one is, okay. Okay. And the third one is a scorn. Sure. like that. That means what a rubbish handwriting is, what a rubbish presentation is. This is very dangerous. This is very dangerous. It's more important. Actually, I have given the order, should have given like this. This is 7th point actually, and this is 6th point, because that is personal, because many people don't even bother that one. So let it be the last point. Okay. So 22:41. Okay. Those who want to study with me, paid fees, you did not do any favor to anybody. Okay. When you are a student, be a student. Learn. After becoming a student, leave this one. Both your mother, your sister, or your friend, or your relative, that is different. You're a doctor, you're a patient, that is not my problem. But when you're a student, be obedient to your learning. Okay? Be obedient to the calling. Work hard, get clear, go. If you pass, you are making your life. If you fail, you're spoiling your chances. Everyone will say only one comment. If you pass, they'll say, wow, very good. If you fail, you poor fellow. What more than can anybody do? So you're not favoring anybody else. You're favoring yourself. Learn to respect yourself. A person who respects oneself, I'm a different metal. I'm a different metal. That's why you see many people say, sir, you are different, sir, your teaching is different, sir, your explanation is different, sir. You explain everything. Even that person who came first time, that dermatologist, that's what it is. That's what it is. Okay. And everyone can, this is all fire. What I'm teaching you is all fire. If you have the courage to pass, jump into the fire. You will become neat and clean and come out. Because fire purifies gold. Okay. For diamond, you need to be hammered. Without this fire, you cannot cross the boundary. Okay. I'm cleaning you. I'm cleaning you. Don't try to teach me how to clean. Don't try to teach me. There was one son, okay. He asked his mother, why did you give birth to me? You are so poor. Why did you give birth to me? It's better you did not give birth to me. So like that. Okay. So mother gave birth. It is should be the intention of the child to work hard and improve. You have a privilege. Everything is a privilege in this world. Nothing is coming free. Somebody is blessing you, so it's coming. The air is a privilege because God blessed you. Okay. Your food is a privilege because your mother is cooking. You understand? You're happy because nobody is troubling you. Okay. So privilege, everything is a privilege. Friendship is a privilege. Okay. Privilege means what? You're fortunate to have something. Don't spoil your chances. It's a shame, One-time failure itself is a shame. You understand? It's a shame. Okay. And take it grantedly and repeating. One time going to the jail only, prison is only a shame. Every time committing the mistake and going every time means is a shameless fellow. Not shame, shameless fellow. How can we do that injustice to ourselves? I'm not saying anything wrong. I'm telling the fact. Okay. So something is wrong. You're giving wrong medicine. So change. Change your attitude, change your approach, change your target, change your strategies, change your techniques, change your everything. The problem is not with the paper. It is the same thing everyone is doing. And many people are passing. Why you are not passing? Problem is where? Then. Mission accomplished. Operation, transformation, learning style, absolute. That's it. If you don't transform yourself now, nobody can help. Okay. Tomorrow I'll do so. Day after tomorrow, I'll say, okay, what I will do? Huh? What I will do? Your thing should be like, I will not sleep until I finish my work. I have to do 4 things: one reading, one listening, one writing, one speaking. I will not sleep until I do this. That is called a determination. Is that there in you? Why are you so vulnerable? Why are you so helpless? Why you so easily accept a defeat? Why are you not a complete picture? Please, from tomorrow onwards, if anybody is ready to follow my suggestions, type your name. I will help you. I'll take you very serious. I am like that mother, after severe labor, delivering you into the world. I work so hard for you people. Every word correcting your word, every word is a pain for me. I'm not taking any less labor. And I teach you for 1 month, 2 months, or 3 months. And I deliver you into the OET so that you go out. Okay? Waiting. Okay? And the day is not far. God has blessed me. God has blessed me. The bright dream which I am seeing is at the threshold. January 1st, I'm going to inaugurate my office. When people come there, no, it should be like how, when somebody goes to the MD and sees, like that. That respect will be there because that will be an educational institution, not a business market where anybody can pay, study and join. And those who respect study only can enter that platform. That's what it is. Because people will definitely come. I know that. There are people who are coming from Andhra Pradesh, from Karnataka to Kerala, in some institutions, in some remote towns. where nurses are teachers. My institution will be only English teachers, and that too masters. Definitely, diamond will get its price. That is what it is. There will be a huge demand because I'll take only limited students. I cannot take many students like how and I cannot teach in groups. I won't take. I selected my diamonds. If I have selected you, that means you are a diamond. But you have to keep your worth. You have to allow me to chisel you. You have to you have to make me put you in the fire so that gold is purified because copper is mixed in it. The real value I have to bring it. So help me to help you. So now, this is not preaching. Okay. This is not preaching. This is my concern for my dear, darling children who are going astray because my elder son is fine. My younger son is going astray, suppose. I will not be worried about my elder son. I'll be going searching for my younger son, pulling him back, slapping him and punishing him and making him set right. Those who are studying already well, I don't need to run after them. Those who are avoiding me and trying to play the fool about themselves and their future, those people only I'm telling. But those people will not attend this lecture. What to do? Those that I fight, I hate not. Those that I protect, I love not. An Irish airman foresees his death, which I have studied 30 years before. I remember every line even till now. I am trying to tell on this platform, those who really need these words will not be there here. And those who don't need these words, they will be here. That is the fun, that is the fun of life. And these diamonds are polished. Those are still as is and where is condition. That is always a sleeping lion. You are a live dog. Those people are sleeping lions. No, not sleeping lions, dead lions. Those are dead lions. I mean, no use with them. No use with the sleeping people. Dead lions. Not talking, I'm not comparing anyone with a lion and a dog. I'm telling the quality. There is no life in the lion because it is dead. No life. No practical benefit, that is the meaning. Whatever they do, there is no practical benefit. But this dog, it is alive. It need not jump like a tiger. If it just barks, enough people will be scared. A live dog is better than a dead lion. Be a live dog rather than be a dead lion. That's it. So what I want you to do is, we are really serious. Write your name there and say that this is an oath, a promise, saying that I will submit you reading, writing, listening, speaking every day. Then you are my darling. Okay? No excuses. Otherwise, sir, I cannot do everything like that one because suddenly I cannot change. First, I'll start with one thing, sir. At least one listening I'll do, sir. At least one reading I'll do. At least one writing I'll do. You're not doing any favor to me, okay? Write that one. Give a promise to me what you want to do. I'll not leave you until you give me a promise. Because these are the names I'll give to Ashwini and she will collect them from you. Whatever you can do, you don't boast. I will do, sir. Okay, give a promise. Your yes is a yes, your no is a no. If you say yes and you don't do, you are untrustworthy. I'm waiting. I'm waiting. I'm waiting. What you can do, write down. I'll do 4 things, sir. Let's write down. Do 4 things. One day enough. That one day will be a motivation for you that you do every day. It is called recurrent. One light you burn, another light you can burn, another light. One light can burn 10 lights. One day you can do 100 days. That is transformation absolute. Try to experience that happiness. You don't know. You don't know. You think how I am managing with so many less students every day? Because of that only. Because I have that burning in me, whether anybody will listen or not. I'm a teacher. Okay. I'm doing my duty. I'm doing my duty. Duty, it is called duty. Okay. Write down. So I don't need to call you by the name. If you say, I will do one reading, do one reading. I'll do one listening. Tomorrow, what you will do, write 1 day's plan. Don't promise me for all your life. Tomorrow, what you will do it. And those students who say, I will do only one reading, and they'll do reading and listening also, then what is the difference? See, self-motivation, self-discipline. Just tell me something. I'm waiting. I'll not leave you. Huh? I know you are diagnosed. I'll chisel you properly. Come on. Write down. Think first. Think before you think. Yeah, nobody is interested to write anything. Maranang Makapo. Write 1 letter following correct format and speaking test content. Very good. That's it. It's not a promise for me, it is a promise for yourself. Not going to get any specific credit for this one. Yes, last 1 minute. It's already 11 o'clock. So 1 minute and closing. Sangeeta Patel. Yes. 7, 6, 5, 4, 3, 2, 1, and done. Select all, copy, post. So let me see who are there. Who's this? Right. Very good. Okay, then, good night.